Good morning and welcome, everyone. I'm calling the 437th council meeting to order. Welcome to our second full council meeting of 2023. As a reminder, council members, please have your video on during the meeting and mute yourself if you are not speaking. And just to underline that we are live streaming this meeting through the RCDSO YouTube channel so that members of the public, profession, and other stakeholders can observe our proceedings today. Before we begin the formal meeting this morning, I'd like to take the opportunity to review some of the improvements we are going to make to our council meeting process, as discussed at the Facilitation First orientation training session in February. Our first objective is to balance the length of discussion on all topics with the size of the council and the number of important topics that we must address at each meeting. This includes our ongoing education, items for decision that have been extensively reviewed by another committee, items for discussion that need input to move forward, and items that are merely for information. Our second objective is to have diversity in discussion and to hear from as many council members as possible over the course of the meeting. Throughout our meeting as needed, I will remind council members to keep their comments to under 2 minutes. So I ask that you have a second comment on an item. It should be a distinct or new point from the first comment that you have already made. And just a quick reminder to use your Zoom hands for voting, as well as for questions and comments. If there are items that are raised that do not apply closely to the agenda item, I will ask that we put them in the parking lot. Staff will keep track of this list. We will review the list at the end of the meeting, if there is time, and if not, the list will be referred to executive or staff. There were 2 parking lot items from our last meeting. The first was in regard to one of 15 dentists not compliant with professional development credits. That item was addressed later in the meeting in a presentation by Susan Taylor. The second parking lot item was about standards for sleep disorders. We will be hearing more about the process for standard reforms later in this meeting from Cameron Thompson. Meanwhile, we will continue to improve how effective our meetings are. That is a shared responsibility between you, staff, and me. Your feedback on the new procedures is welcome. And now I would like to turn to the official land acknowledgement this morning. This new land acknowledgement has been developed by staff. It is based on considerable research, as well as learning from the first people session that many of you attended in May. The intention behind the revision was to more closely connect the land acknowledgement to the work we are doing at the college and here at council. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis people from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between the Allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace the role we play in regulating dentists, in protecting the public interest, and in strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. Thank you. And at this point in time, I would like to turn things over to the Registrar and CEO, Dan Faulkner, to do the council roll call.
Thank you, Hanno. As everyone knows, I will do this in alphabetical order, so just be anticipating and unmute yourself when I call your name, starting with Nalan Bhargava.
Present.
David Bishop. We are expecting David today, but it doesn't sound like he's arrived yet. Amelia Chan.
Present.
Ram Chopra. I know Ram is there. I see his phone is muted. Ram, we will count you as present. Jamie Colliver.
Present.
Christina Cordero.
Present.
Peter Delane.
Present.
Nancy DeSanto,
Present.
Mark Eckler,
Present.
Ellie Fisher,
Present.
Noha Goma,
Present.
Daniel Haas,
Present.
Vivian Hu,
Present.
Anthony Mayer,
Present.
Harinder Sandhu,
Present.
Brian Smith,
Present.
Osama Solomon,
Present.
Robin Somerville,
Present.
Rod Stapleforth,
Present.
Mark Trudell,
Present.
Aaron Walker,
Present.
Judy Welikovich,
Present.
and Deborah Wilson.
Present.
And thank you, Hanno. And we'll just reflect that I understand that Christina Cordero is departing the meeting around 1:45 today. So we'll note that for the minutes as well. So back to you, Hanno.
Thank you, Dan. At this point in time, I'd like to turn things over to Dr. Harinder Sandhu for the president's remarks. But first, Anthony, do you have a question?
Yes, I I didn't hear my name, but I am present.
Anthony, I am so sorry. Let me just make sure it's on my list, but thank you for noting that.
You're very welcome.
Thank you, Anthony.
Thank you.
And your presence will be officially noted. Thank you for that. And thank you for putting your hand up. And now I am
Apologies for that.
turn things over to Dr. Harinder Sandhu to provide the president's remarks. Harinder?
Thank you, Hanno. And good morning, everyone. It's a great pleasure to see you all today. In the past week, I've had the privilege of speaking at a graduation event at the University of Toronto. And next week, I'll be speaking at Western University. It's a meaningful moment in a person's life when you move from being a student to a professional. It was great talking to students and faculty and underlining our role as a college in their professional lives. I also had the opportunity to deliver remarks to the ODA General Council on April 28th. I spoke to their council about vital topics, including our strategic plan, COVID-19 guidelines, standards, and college governance. We have a packed agenda today, and I look forward to our presentation and discussions. The first, I would like to underline three very significant issues that we'll be discussing today. The first is governance. A wise person once said, continual improvement is an unending journey. Evolution in our governance process must always ensure we serve the public interest to the best of our abilities and the most current thinking about our work. If we don't keep improving, we risk the government chaining for us. You will hear more about this from me later today in a report on the progress of our governance committee. I also want to underline the importance of our work on standards, guidelines, and advisories. Standards of practice are at the core of what we do. These parameters guide dentists in all that they do. We have heard from members of the profession, the public, and the council about various standards that must be updated and developed. At my request, staff have developed a proposal for additional contract staff to fast track this work. The additional help is required to do the work council members have recommended. The Finance, Audit, and Risk Committee approved additional dollars over the next 30 months. And as a reminder, these staff members are not permanent. They will be here for limited terms only. And as our work is completed, their jobs will finish. Related to this, council will hear from Cameron Thompson today about the work underway on the 25 standards of practice, guidelines, and advisories. Cameron will walk us through how we are prioritizing this critical work. The council should also be aware that we are getting ready for the potential implementation of the emergency class of registration certificate approved by the council in April meeting. At our last council meeting, I committed that you would be up to date on this crucial matter for the profession. The latest information from the Ministry of Health is that all 26 colleges will have their emergency class regulation approved by the deadline of August 31st. The executive committee recently discussed and established a working group to help with the implementation of this critical issue. The working group will be active over the summer. They will address several issues to ensure effective and responsible implementation if government or council ever needs to invoke the emergency provision. And this working group has had their first meeting this week, and a lot of progress has been made. Also include guidance for supervising registrants in the emergency clause, a critical public safety element of the regulation. One final item that I would like to highlight is the COVID guidance. We have all been hearing concern about updating this guidance given the current health indicators. We will hear later this meeting about staff's strong progress toward updating the guidance. And Mr. Faulkner has assured me that he has also been speaking with other oral health colleges, and they are on board with our position. As Hanno noted at the outset, we have taken up many of the recommendations from facilitation first. The chair, the registrar, and I will continue to work as a team at council meetings. All of the council helps ensure that we have good discussion, questions, and participation. I thank you for that. It sometimes seems we have too much on our agenda, but we all work hard to hear your input and reach reasoned decisions when possible. I want to take a moment to acknowledge the staff for all your work in preparation for our meeting. You do a great job building and assembling the agenda and materials we need for our roles as governors. You help us provide the context and background for all of our decisions. Thank you. Dan, the senior leadership team, and the entire staff of the college, thank you for your excellent work. As council, we will hear today significant progress is being made on many fronts in the first half of 2023. Our topics today blend our regulatory obligations with council education and building the organization of the future with our strategic plan. Finally, thank you to my fellow council members for your commitment, guidance, wisdom, and all the time you dedicate to the public interest. I have enjoyed our one-to-one phone calls over the past few weeks and learned so much from all of you, and that will continue. I want to acknowledge the member of the public who are joining us through YouTube channel. We sincerely appreciate your interest, and I hope we always stay true to our mandate of the public interest and that you enjoy the debate and discussion. So thank you for being here, and we welcome your feedback. With that, Hanno, I'll turn it back to you. Thank you.
Thank you, Harinder. I'd like to move now to the declaration of conflicts of interest. Just a reminder, council members, that conflicts are important to declare because of our public interest mandate and as a standard reflected in the Ministry of Health College Performance Measurement Framework. I would like to note that to council that 2 new forms have been submitted since the package was sent out. They will be included in the next council meeting materials and posted online. So at this point in time, I will ask if any members of council are aware of any conflict of interest that they have for any items on the agenda today. And I will take a moment because I think in the past I may have rushed and not given people enough time if they were looking for the raise hand function. So I will sort of give you a 10 to 15 second window right now. If you do have a conflict to declare, please indicate so using your raise hand function. Thank you. I'm seeing none. I would like to now go to the consent agenda. We are going to continue using the consent agenda as a time-saving mechanism. On the consent agenda are multiple items that are for council's information, and council will be asked to approve these in one motion. You can, of course, ask questions of clarification about an item on the consent agenda, but if council wishes to have a more fulsome conversation of an item, we will take it out of the consent agenda and address it later on during the meeting. As always, I would ask council to use a very high threshold when asking to remove an item from the consent agenda. And this is so that we can effectively manage our time and make sure that we are reserving the time for thoughtful and focused discussion on items that require our decision. The consent agenda items are in your meeting materials starting at page 50 and going on to page 86. At this point in time, prior to putting up the motion, I would ask if there are any questions from members of council regarding any of the three items that are in the consent agenda. Seeing none, I would ask that the motion for the consent agenda be put on the screen, please. It is motion number 1. And I'm asking that the following items be approved and or received for information by council. Approval of agenda, approval of RCDSO council meeting minutes from April 4th, 2023, and the registrar and CEO report. And at this point in time, I would ask for a mover. Moved by Mark Trudell, seconded by Aaron Walker. And what I'm going to do now is we will see, I'm going to ask all those in favor. And again, I would ask you to use your raise hand function. And Angie and I will scan the screen to make sure that everyone is having an opportunity to vote. Okay, I'm seeing, to me, that looks like unanimous approval. Do you agree, Angie?
Yes, yes, it is.
Thank you. Unanimous approval, so that motion is carried. Thank you very much. I'll now give you a second to lower your hand. And while you're doing that, thank you very much. I am now going to ask the registrar and CEO for his remarks. Included in the consent agenda is the written report from Dan. The report can be found on pages 71 to 86 of your materials. And Dan, I'm going to ask you for a few opening remarks for council.
Thank you very much, Hanno. And I'm going to keep my remarks fairly short, and I want to turn it over to RCDSO to talk to you a little bit about the corporate dashboard report. But first, I do have some slides, if those can appear. Next slide, please. I'm not going to reiterate everything in my report, but I'll focus on a couple of key activities. First, I do want to thank and acknowledge council. We had a fabulous training session on May 26th, and that, as you know, included 4 councils from all 4 of the oral health regulators in Ontario. So dentists, denturists, dental hygienists, and dental technologists. This was led by First Peoples Group, and it was really a fantastic day to understand much more about First Nations, Inuit, and Métis culture and history, really starting to think about biases that exist within ourselves and within society, truth and reconciliation, and really understanding that the impact of all of this is quite significant, and what that means to oral health care. So a really fabulous day. I know that I've heard from some of you and you've had a chance to reflect on it. And I want to acknowledge and again, thank you for being able to come to that workshop on such short notice that we had, and also to let you know that there will be continued discussions and activities as we move forward this year. Next slide. I just want to briefly talk about some of the what I call watching briefs that we have with different levels of government. And you've heard about most of these before, but a bit of an update. First of all, the provincial government, most of what has been occurring in the environment is related to health human resources. So that includes the as of right legislation, Bill 60. That bill has received royal assent. Most of that bill, as I've said before, focuses on community-based clinics. And some of it has to do with allowing for individuals from other provinces to come to Ontario to practice and not having a certificate of registration from one of the colleges before practicing. That has now seen, as of this week, regulations that have been posted to the government site that are looking at more of the detail around how that will work. And I don't have a full analysis of those regulations at this point, but it does address some issues that relate to having applications that go to colleges before the individual can start to practice in Ontario, restricting any practice to long-term care homes and hospitals. And I'll also remind you that it only applies at this point to 4 professions, and that doesn't include any of the oral healthcare professions. So again, it's a watching brief and really important for us to understand if it were to be applied across the oral health professions, what that might mean. The emergency class of certificate of registration, we are now into some of the operations while we wait for the registration, or sorry, the regulation to be passed. We are assured that this is still on track for the end of August. And you heard from the president that there is a working group that consists of a couple of members from the registration committee and the quality assurance committee to really start to hone in on some details in the event that there could be some reason to invoke the emergency class with the RCDSO. We're not anticipating that, but we want to be ready with issues like supervision and what that will mean and what's expected of supervisors and so forth. I can share with you that senior staff have had meetings with the Fairness Commissioner and his staff, and also Ministry of Health staff. And these meetings have focused on the NDEB examinations, and particularly the 3rd examination in the equivalency process for internationally trained dentists. We met with the Fairness Commissioner with senior staff from the NDEB, which is the National Dental Examining Board of Canada. And we met with the ministry to also describe some of the issues that we have identified from various groups, including groups of internationally trained dentists who are concerned about the fairness of the exam. And we were able to provide both the commissioner and the ministry staff with current and accurate information about the exam and about the RCDSO and the NDEB and how we are working together. And sticking with the provincial government, I am not any more aware today whether there will be any governance reform legislation. So I will certainly keep you informed if I hear anything. We are expecting that there may be something in this mandate of the provincial government, but at this point, I don't have any late information. The national update is quite extensive, and I'll really just limit my comments to the Canadian Dental Regulatory Authorities Federation, CDRAF, has met on 2 occasions with the Federal Dental Program Task Force. As the chair of the CDRAF, I met with the executive director of CDRAF, and I met with the federal task force. And we provided the regulatory views about the dental program, the commitment to access, our commitment as regulators to access to care. And obviously there is advocacy that's occurring at different levels, but our focus is really on access and how that can be best facilitated within the various provinces. I'm very pleased to share that one of the advice or advisories that we received from the Fairness Commissioner in February 2022 was for the RCDSO to be more attentive to our expectations of the national exam provider. And so we've recently signed a memorandum of understanding with the NDEB, which is provided in your materials, and it outlines our expectations of service standards, quality assurance, exam delivery, item banks for questions, and so on. And it really is to fulfill our legislative obligations as a third party, as the NDEB as a third party, and our need legislatively to ensure that they're fulfilling their obligations for fairness and impartiality and transparency. And we've had a number of different interactions with issues that relate to internationally trained dentists. I recently provided a fairly comprehensive presentation to the executive committee, which I'm not planning to do today, but I can certainly do that with council in September if you wish, to try to provide context in terms of how all of the organizations fit within this spectrum of internationally trained dentists trying to be licensed in Canada and in Ontario, and what some of the current issues are, and what some of the current accurate information is about examinations and processes. I know that executive was very attentive to that, and as I said, I'm very happy to share that with the group if you wish. Next slide. I think measuring our progress is quite an important issue for council. And so I want to just provide a very high level overview of the different ways in which we measure what we do, how we do it, and not as easy, but what is the impact of our measurement. So starting with the college performance measurement framework, you've heard lots of information about that. I'm not going to reiterate it here today, but I do want to let you know that I participated in a podcast it was recorded about 6 weeks ago. It was released about 3 or 4 weeks ago. Happy to provide you with the link. It's quite lengthy, but there were different perspectives that were brought to the table in terms of CPMF. And I think it's a really good way for us to share what CPMF is all about, what it actually measures, what it can't do, and what the future may look like. So I'm happy to share that link with you at any point. We have committee reports in this agenda package. So multiple committee reports. Our commitment obviously is an annual report from every committee. This batch of reports deals with 2022. So if there's something that you think might be missing and it's happened this year, that's why, because we focused on the calendar year. But it certainly provides you with both narrative, high points, and measurements from those respective committees. There is, as I said, going to be a very brief overview of the council dashboard report in a moment. And this is really to provide you with more information that's more regulatory in nature and about the programs of the college. And finally, you'll hear today about some of our work, which you'll hear a lot more about in September, around key performance indicators that will help council to know, are we making progress on the strategic plan? So those are various ways in which we are measuring both our performance and hopefully some of the outcomes. And I'll ask you now to turn to the next slide. I just want to say that there has been quite a bit of activity this year, obviously over the last year or two. And I really want to comment on how there's so much opportunity for this college and regulation and what we are doing. And I thank council and all the work that you've done to really focus governance in a direction that is responsive and anticipatory. I also thank council for your work on the strategic plan. And as we've launched into 6 core areas of focus, or as we call them, 6 projects that relate to the 3 themes that you identified. We have certainly heard you, and we're looking at your strategic direction in areas like getting a better handle on how we do standards, what standards we do, how we make them accessible to the profession. We are also looking at how we pay attention to governance, as I said, in terms of our anticipation, and on and on. And I can certainly comment more as we talk about the strategic plan later. And I also want to thank staff. We have a fantastic group of staff at the college, as you know, because you interact with them with committees. These are people who are going out of their way each and every day to be excellent, to produce results, and they do so with a lot of expertise and compassion and innovation. And I really want to thank them, because you see them sometimes when you're at committees, you see them for the president and others when we do preparation for this meeting, you see them on this call. But I think you should also know that you're seeing them really reflected in all of the committee reports, because they are actually behind all of the work of committees that allows those committees to shine and to do its job, and to do it according to the legislation, and to do it quite well all the time. So next slide, please. This is just a brief overview of the issues that you're going to talk about today. I'm not going to go over it, but I hope that you see that there's a lot of attention to the strategic plan. There's a lot of attention to issues that are governance. There's a balance of issues, as the president mentioned at the beginning, that have been through committees, others that need decisions, others that need discussion, and just a lot happening at the college at this time, and a lot of things that matter to you and to me and to all staff. So we will get through this agenda, and we will keep hearing your feedback about how to become better each and every meeting. So next slide. I'm going to turn it over now to Eric. And Eric DeSaw is our data scientist, and he's going to walk you through briefly the dashboard report, and then we'll stop for questions.
Thanks very much, Dan. I appreciate that. Given the packed agenda that we have today, what I'm going to do is share my screen and run through Very briefly, the council dashboard report that relates to the operational highlights. For those of us who are joining council but are not able to see my screen, I refer you to pages 75 to 86 of the council material where you can find the same content. Just to keep everything high level, I'm only going to be focusing on 1 or 2 items per slide. The overview, and this was first introduced at the previous council meeting, in that the sense of we are going to be presenting highlights from different areas across the college that relate to the operational work that is currently undertaken. For the first few slides, I'm going to group them together, and just to let everyone know, this is related to the bridge, which is our new CRM. This was a multi-year initiative that we spent a great deal of time on, and this was to improve our ability to interact and correspond with members of the college, as well as how we interact with all operational aspects within our purview. The main idea here is that what I want to convey is that this is a huge and intensive project that is now wrapping up to completion, to the point where we're going to have multiple stages of smaller releases. And this is so that every staff member within the college that has an operational component to it will be able to interact in a harmonized way. As it relates to quality, we have the quality department has done undertaken another huge IT-related initiative to update the ePortfolio platform. And what I really want to just bring everyone's attention to is we created a multi-stage or multi-phase approach in very small sprints in order to improve the ePortfolio platform. This is something that all dentists are going to be able to really appreciate over the coming months as we release it in June, July, and September for a multi-stage release in order to improve the functionality for those who are inputting and recording their CE-related credits. For PET, again, this relates to the different stages that are required in order to improve the aspects of the practice enhancement tool. What Susan Taylor has wanted to convey to everyone is that there's multiple stages within the development of any type of question response system. So between the blueprint development all the way to the final question selection, this is undergoing a review across 7 different areas within the college, 7 different areas within the practice enhancement tool. For registration, this was a slide that was shown at the previous council meeting, and we've updated it with March and April numbers, and we're continuing to show that we're meeting the regulated timelines for application processing. So this relates to when the application is first received by the college to when we are interacting with the member. Likewise, we are also meeting the regulated timeline for application decisions. So this is for when we're meeting the time for the actual decision that is being made and responded back to the member or the applicant. Similar to the previous council meeting, we're showing within the facilities inspection program the number of completed and remaining backlog of provisional CT facility permits. You can see that we've moved from 59 all the way down to 2. We just have a few left, and then at that point, the facility inspection program team will be completely finished within the backlog. And finally, the last 2, these are similar slides that you've seen for the past few council meetings. They relate to the PCRA, the number of open case files by month. And this is showing that compared to last year, while we have had a number of, we have seen an increased number of the case files that we've had, we're also actively moving towards moving the backlog off of our system. And this is demonstrated by showing that the 2023 case files that we have, of course, are expected to increase. But all of the backlog related to the 2019 to 2021 case files, and including the ones from last year, are continuing to decrease. So PCRA is making continued strides in this area. I'm going to stop sharing my screen, and I'll hand it back over to Hando now.
Thank you, Eric. And council, we do have a few minutes for questions, either for Dan or for Eric. I would ask that you use your raise hand function. I will be keeping a speakers list. I will be giving preference to first-time speakers. And again, just out of respect for everyone's time, I would ask that if someone has already made the comment you wish to make, or the question that you had has been answered, when I call your name, simply pass. So I am going to see if there are any questions for either Dan or for Eric. I see a few. Rod Stapleforth, you're first, please. I think you need to unmute, please, Rod.
Sorry, Hannah.
Thank you.
Eric, good presentation. Just a question on your IT rollouts to the members. How has the experience been with them? Have we had to do any how-to sessions or Q&A sessions, and how are they responding to the changes?
You know what, that's something I'd have to actually get back to you about. I'll have to connect with Susan Taylor as it relates to the quality one. When I was showing the overview of the bridge is the internal CRM. That's something where we've had multiple consultations with internal staff in order to approve the different segments of it that relate to different areas of the college, whether it's PCRA, registration, FIP, quality, what have you. That's an internal one that has had a lot of interaction. As it relates to the quality one, I'll have to get back to you on that one. I believe that there has been separate sections where we've been able to pull in different members to have a review process of it.
Good, thank you.
I just wanted.
Oh, sorry. I'm sorry, Dan.
I'm just going to jump in because there is extensive testing. Rod, we haven't actually launched yet the first version. And there is extensive testing both with internal dentists and external dentists. We are going to monitor the feedback, and we are going to certainly address any concerns that are immediate. But there's been a whole process around that launch for the CE portfolio that will help us to ensure that we put out the right kind of support for members to be able to navigate it. And we certainly expect it will be a lot easier than it once was. But we can provide more to council as we move forward. And I know you were away at the last meeting, but there was another presentation on the quality assurance program at that meeting as well, which we can provide to you.
Thank you, Dan.
Hanno, could I just, if you don't mind, I just wanted to build on what Dan said, Rod, to your question about how-to sessions. Part of Susan Taylor's approach to launching the e-portfolio will be to build out some video vignettes to really illustrate to dentists how to use the new platform. Susan's doing a great job together with other staff partners to really think about the user experience and how we can support dentists. So we can certainly give you more detail, but I did want to let you know that that was part of the deliberate sort of planning around this.
Thank you, Andrew.
Thank you, Andrea. And Rod, I would ask if you just sort of lower hand now so that I can move across the list. And Usama, you are next.
Thank you, Eric, for your brief presentation. I have a question with regards to what type of data projects are we looking to do for the different departments going forward? I see that you have some information with regards to what's being done now, but what plans do we have going forward in terms of data analysis in the different departments? I see that there's some good information in registration. What are your thoughts on that?
Lots of things are happening, and probably I could take up a lot more of our time. I want to say that our approach right now as it relates to data analysis is really to embed it as it relates to both the operational and strategic objectives within the college. So it's not a data project per se, it's what is the strategic project or what is the operational initiative that we need to undertake, and how does data analysis, research, and evidence support that initiative? So as an example, one of the objectives when Jillian Slaughter came on to be the director of PCRA was to really drive down the timelines for all of the different all of the backlog of case files that we were experiencing, and we've demonstrated that over the past couple of years. So we were using data in terms of being able to pull it from the perspective of when was the case file that came in, how was it triaged initially, and how was it approached in a way that that Jill and her managers and the rest of the PCRA department were able to implement their own improvement initiatives to really decrease the timelines and overall decrease the case files. The same type of concept is being done across the college in different areas. There are other data related projects, including something that related to the Ontario how dentists practice in Ontario, and that's going to be a separate presentation later on. But I'd be happy to follow up with you later to talk about more initiatives that we have planned going forward.
And that's great that that's an amazing answer. My biggest kind of thought process with this is, are there like a list of questions that we're answering from each department? And it'd be kind of cool to see what those questions are and where we're kind of which direction are we moving? Because there's so many, like you said, there's tons of questions and there's tons of data to gather. Are we answering the right questions? Are we collecting the data that's appropriate for where we want to move? And in that regard, I think it'd be kind of cool to share some of those questions as well. Again, not to take up too much time with what we're doing here, but maybe and then I look forward to the next presentation as well. But maybe sharing some of that information as well in terms of where we're going to collect some more data would be very useful.
Great question. Completely agree with you. Different departmental heads have these questions as well. They're using it within their own internal purposes first, and that's part of the overall testing process within it. I'm going to take that comment back. I think that's a really good idea. And I want to make sure that when next time that we're going to be presenting anything related to the data related projects that we're undertaking at the college, it really reflects on the different types of initiatives that the department heads have been undertaking, so that we're actually reflecting on it and presenting it. And something to keep in mind with all council, whenever you're talking about research, analysis, data, statistics, it does take time. And Osama, I really appreciate you saying, reflecting on that and saying that these things are questions where we need to first ask, are we collecting the right data? And that's something we're continuously asking ourselves and we're continuously refining. We know that we need to start somewhere. So we start with the data that we have, and then we see how far we can answer the questions that we wanted to answer. And then we refine as we move forward. So I'll take that back and we can reflect on that too. Thank you.
Thanks, Osama. And last speaker is Peter Deline.
Good morning. Thank you, Mr. Speaker. Just a question for Dan. With regards to the memorandum of understanding with the NDEB, just wondering, does that in any way change our financial obligations to the NDEB? I know we're a client of theirs, and I just curious if our financial obligations have changed in any way.
No. I don't believe we have any financial obligations to the NDEB. I have not seen any way in which we support the NDEB financially since I've arrived. Really what it does, Peter, is it provides another layer of accountability, as NDEB is a third party to our licensure process. They provide an important source of information that contributes to our ability to license dentists. And it sets out those accountabilities across things, as I mentioned before, like how they're going to be transparent about the service that they offer, what their timelines are. So it doesn't really add any accountability to us. We will continue to work with the NDEB, and there's no financial support of the NDEB, but we do provide a member, as you appointed last time, Noha Goma, as the RCDSO representative to the board, and that is all funded by the NDEB as well.
Good. Yeah, I was just curious about, there's the PET questions that are developed. I thought they were developed at the NDEB, but I may be wrong.
So no, well, you're right. They were initially, but now they are developed completely by us.
Thank you.
Thank you, Dan. Thank you, Eric. Peter, I would just ask that you lower your hand now. We are going to move on to the agenda. The next item is appointment to the registration committee. Before we begin, I would ask Angelo to please move Ellie into a waiting room. And Ellie, we will reach out to you once this motion has been considered. Thank you. So Ellie is now in a waiting room. So council staff is proposing that a second public member be added to the registration committee to ensure that a public member is always present when the committee considers applications for registration. The materials for this item are on pages 87 to 88. This is an item that will require your decision. And at this point in time, I'm going to turn it over to the Deputy Registrar, Andrea, to walk council through this proposal. Andrea, please.
Great. Thank you, Hanno. Good morning, everyone. You've gotten your package, as Hanno flagged, a briefing note on this subject. As Hanno mentioned, we're simply looking to add a second public member to the committee. It will give us a little bit more flexibility in terms of scheduling, and also ensure that we can be certain that we will have at least one public member always in attendance at committee meetings. I think it also brings us a bit closer to parity with this committee in terms of professional members and public members. Proposing that Ellie Fisher be the public member appointment. Ellie has sat on the committee previously. She's expressed interest in doing so when we sent out the preference survey back in December of 2022. She has confirmed her interest in doing so, in being our second public member. So this is coming to you. The executive committee did consider the matter at its meeting in May. They supported that proposal, but it needs to come to you for decisions. So that's what is in front of you today. Do you support Ellie Fisher being added as the second public member on the registration committee? Hanno, I'll turn it back to you, and I'm happy to help if there are questions.
Sorry, I think I was muted. I'm just going to now open it up to questions. Judy, I see you do have a question.
Yes, is this motion to determine whether we have a second public member, or is it to appoint Ellie as the second public member?
So the motion that I'm going to be asking council to entertain is specifically, Judy, that council appoints Miss Ellie Fisher to the registration committee effective immediately. So that is the motion that will be brought up in a moment.
So forgive me if I'm behind the times here, but have the terms of reference of the committee been changed so that it allows for a second public member?
Andrea, I'm going to turn that over to you, please.
Yeah, thank you, Hanno. I don't believe, I'm just sorry, and Judy, I'm just looking at the briefing note to see if I can get that detail, but my understanding was that we didn't need to update the terms of reference to add the second public member. We did consult with staff in terms of the governance steps that are needed. I'll let Dan or others come in and obviously correct me if need be. We know that our bylaw says that there needs to be at least one public member, but it doesn't set, as I understand it, a requirement for how many beyond one. So my understanding is that we have all of the process pieces in place, and council is free to approve this motion should they wish.
Okay, and I've got Dan's hand up and Alan, so I'm going to go to the two of you first. So Dan, you first, please.
So I will turn it over to Alan, but I also want to say that this is a proposal that the issue was raised by staff with the executive committee, and the executive committee is recommending this. I just want to draw that distinction. And I'll ask Alan to comment on the public member composition for the registration committee.
Thanks, Dan. Alan?
Thank you. There is no bylaw change required in order to add another public member. Bylaw already contemplates that you can have more than one public member if you wish to do so. So there's no composition change required.
No, I was asking about the terms of reference for the committee itself.
The terms of reference don't require changing. They're exactly the same.
Okay, thank you.
Yeah, that's right.
Thank you for the question and the responses. Last name on my list is Vivian.
I just have a question. I know that, is this because the public member will be away and this is like a backup? Do they both need to be on the committee at the same time?
Andrea?
Yeah, thank you, Hannah. They don't both need to be on the committee at the same time. And you're correct, Vivian. This was because we were aware that due to some personal plans, we were going to have our current public member not be in attendance for a period of time. So this gives us the flexibility to have one or both of the public members attend a meeting, but there's not a requirement that both do so at each meeting.
Thank you.
Thank you. So at this point in time, I would like to ask that the second motion for council's consideration is put up on the screen, please. Oh, I'm sorry. I was Anthony. I'm not sure. I did see a hand all of a sudden go up, but I'm not sure whose it was. Anthony, do you have a question? Okay. I'm thinking not. Okay, so thank you. My apologies. Could I have that motion on the screen, please? And the motion for council's consideration is that council appoints Ms. Ellie Fisher to the registration committee effective immediately. And if I could have a mover for that motion, please. That's moved by Vivian, seconded by Nalan. And again, what I would ask, all in favor, please use your raise hand function. And Angie and I will scroll through. Deborah, you're the only one who I don't see. Are you voting in favor of this? Yes. Okay. So I see that, Angie, as unanimously moved. Do you agree?
Yes, I do.
Okay. So that is unanimously carried. Thank you very much. And at this point in time, we would ask Angelo to please bring Ellie back into the meeting. And once she's back in, we will continue on with the agenda. Council members, please, now you can take the opportunity to lower your hand. Thank you for that. And Ellie, welcome back and congratulations. And thank you for your service and for being willing to take on the role of a new committee. Next on the agenda item is the RCDSO presentation of the strategic plan 2023 to 2025. So a report on that, along with the template dashboard, are included in your materials from pages 89 to 102. This is an item for discussion. This report, which will be a regular feature of council meetings, will provide council with a summary of projects and a status report containing highlights of ongoing projects. Andrea will provide some brief introductory comments, and RCDSO's data scientist, Eric Dessau, will provide council with further information about the dashboard. So at this point in time, Andrea, I'm going to turn it over to you, please.
Thank you, Hanno. So council, as Hanno has mentioned, the report that's in your materials is something you're going to be seeing each meeting. Those of you who have been on council for a few years now will know that we did something similar with the last strategic plan. So this is our commitment to council to make sure that you're up to date with the work that we're doing to execute your strategic direction to us. What I wanted to turn your attention to very briefly, because I do want to make sure Eric has the floor to talk through his elements, but I wanted to draw your attention specifically to page 90 of the briefing note. It's the bottom of that page, and you'll see that there's a chart embedded. And here in the chart, the goal is to come to you with updated status for each project at each council meeting. So what you will see meeting over meeting is a similar chart. We'll keep the strategic objective and pillar there. We'll keep the description of the project and the key players, but the status will be updated each council meeting so that you have an understanding meeting to meeting what's been happening with this project. So I'll just sort of briefly sort of talk to you about in terms of standards. You'll be hearing later in the meeting from Cameron Thompson, who is our manager of standards and strategy. You'll be hearing a bit more from him about work underway to review and modernize our process for standards, and that includes the development of a prioritization tool. You are going to see later in the meeting a new draft standard on virtual care. And you'll also be hearing from Cameron about work underway for COVID. Access to care, there's a separate briefing note in your package about that project, so I won't sort of pause on that. You have that information that Jean Hopkins, our project managers, put together. In terms of service experience, our project manager, Michelle Tremblay, has been active on this file. You can see that information there, lots of activities to support our French language service and our work on accessibility. We have a new phone system to help increase our service experience, and we're looking critically about the service experience responses we got from the membership. We included some questions on the annual renewal questionnaire to see how dentists were finding their experience with us. Those are under active review. Michelle has raised those with each of the respective program areas so that we can learn from that feedback. Again, the equity, diversity, inclusion file is active. Michelle Tremblay is our project manager and our EDI lead at the college. You can see here a lot of activity. We have a dedicated channel to receive information and to send out information. Dan mentioned we had a great presentation and a dedicated session on Indigenous issues, as well as some other orientation issues as well. Development of a new land acknowledgement, and we have an internal EDI committee that's supporting some work on the college's own journey with EDI. Governance review and modernization, you'll be hearing a bit more on this later, but this continues to be an area of active focus. Particularly what you'll be hearing from is the work that's been done to implement and develop a new governance committee who's going to be leading the college's work. And last but certainly not least, you're going to see work that's underway on our practice models and corporate dentistry project. Michelle Cabrero-Gali, our senior policy analyst, is leading this project. And really at this stage she's undertaking a lot of research into understanding different practice models related to corporate dentistry, and giving some thought to implications for those models from a regulatory perspective. Data will, of course, play a key role in this project, as it will in many, many projects. I'm going to leave my comments there. Eric is going to be speaking with you momentarily. He's going to provide you with a little bit more detail around work to develop key performance indicators for each project. So Eric, I'm going to turn it directly over to you. Thank you.
Thanks very much, Andrea. As mentioned before, anyone who is attending the meeting but unable to see my screen, you can jump to pages 99 to 102 of the materials. That is a really high-level skeleton mock-up of some of the dashboards in terms of how it's going to be laid out, but we still have yet to populate it with the visuals. What I'd like to do is just spend a few minutes and going over with everyone on council, not to review the strategic projects, as Andrea has given a status update on all of those, but to talk about the approach to developing our KPIs, as well as introducing those KPIs to council. Again, as a high-level review, there are two strategic projects for each of the arms of professionalism, stakeholder engagement, and emerging issues that were identified as the priorities for our current strategic plan. Each one has a dedicated project manager and a project sponsor or co-sponsor in a couple of cases. As we were developing project management, strategic plans this year and the strategic projects for them this year, what we did is we took a more thorough investigation of what were some of the shortfalls from our previous project management initiatives that were supporting the strategic projects from the last project strategic plan. And so what we have done is been very thorough in terms of our approach, at the same time understanding that we have very limited resources here at the college. Not only do we have a dedicated project manager for each strategic project, but they are also ending up being the content expert in many ways. So we have to understand that they are fulfilling two roles. Not only are they pushing the project forward, but they have to manage it as well. So we wanted to make sure that the resources that we provided them were robust enough that the project sponsor and the project manager had a template and a resource to review anytime that they had questions related to the strategic project, as well as additional and optional materials that could help support them and give them the flexibility to work in a nimble and flexible fashion. For our KPI development overview, I want to just emphasize to council that we were very rigorous in this approach. This KPI development is driven by the project manager, and it's partnered with the project sponsors. The idea behind this is that the project manager and the project sponsor will have open communication and understand of what should be reported on and what should be a good indication of both project performance, progress, and success. We were approaching it this way to address some of the previous challenges with the first strategic plan. And our main concept is that anything we're reporting on should be simple and it should be flexible. If we find that we're reporting on something and it's not working, it's not hitting the mark, it's too difficult to understand, then we'll pivot. And we want to make sure that whatever we're reporting out to council and to the public is something that everyone can understand as it relates to the development and the progress of the KPI. Our objectives were to implement a multi-phase approach to KPI development. This is based off of research and evidence that has undertaken in other industries within KPI development. We explored and explained the difference between metrics and indicators and KPIs, and we reinforced the goals that the primary goal of a KPI is to measure performance and progress. The secondary goal, though, is to report this out to council, and we're doing this through the council dashboard report. We set initial milestones so that every project manager, by the time that they'd completed their project charter, had a list of somewhere between 3 to 5 KPIs. There's some exceptions to this, but we're not going to be over-reporting on anything. We don't want to spend more time tracking and identifying reporting on any of the KPIs. We want to spend more time on the work. I'll flip through these very quickly, but while the project charter was being developed for the strategic plan and understanding that the strategic plan is a three-year initiative, so the strategic projects would align with that 3-year initiative for the plan, we took the first 3 months to go through a series of stages from identifying the concept of strategic project metrics to reviewing and refining the KPIs to all the way to identifying and any of the remaining items on the list for the development of this. From there, and this is where we're moving to right now, or we've moved to right now, we've developed the KPI names for the survey capture, and we're currently having all project managers beginning to undertake the process of data collection. This is something that takes time, so we're improving upon it and looking at how do we make it more efficient for all project managers so that they are spending less time tracking and more time doing. For the next few months, and something that we're going to be reporting out for the September Council, is the actual KPI that relates to the strategic project. And this is just to give an indication that KPI development takes a lot of time. It takes a lot of work. We were embedding this within the project charter development so that the project manager had a clear understanding of what should be reported on and what would help indicate progress towards their success of the strategic project. We're just highlighting here, we also need project managers a few weeks at least to just have a runway to start their strategic project before they can even start the data capture part. The result of all of this, and a lot of evidence supports this, is that if you're having an integrated approach with KPI development from the onset of developing your strategic project or projects in general, you'll have more meaningful KPIs, and they're better reflective of the project performance and the overall initiative. As this relates to council, we introduced the high-level template last council meeting, and that's also included in the council materials here. I'm going to be introducing the KPIs for this council meeting, and starting in September, you're going to receive a much shorter report. It's really just going to be a dashboard that indicates the progress towards each of those KPIs that you can use in tandem as you're reviewing the status updates that were part of the briefing note that Andrea just explained to everyone on council. So our KPIs for the strategic projects are as follows. For strategic project 1, college standards, we're going to be reporting on the number of standards under review, the number of standards that are approved, and the progress of standards through each of the phases. Something to note is the number of standards approved. This is going to be a KPI that we acknowledge that is going to be on there, but we may not report on it for the first period of time because there are, of course, going to be multiple stages that the standard is going through that we're going to have a metric that we can't report on. We can't fill in data until we have something completed to show. For access to care, we have the cumulative total of dentists who have completed continuing education activities related to categories 1 and 2, and the progress towards development of professional and good practices document. For the service experience, we're reporting on percentage of the key materials for the public and the profession that are available in French by 2025. And progress towards improving service experience for the public and the profession. So each of these have multiple tasks, deliverables, and milestones that feed into the overall KPI that we're reporting. For our equity, diversity, and inclusion initiative, we have 2 that we're reporting on currently. Progress towards reviewing all internal policies through the EDI lens, and the overall number of participants who have attended EDI learning opportunities from the RCDSO. In fact, this is something that Michelle Tremblay has already started reporting, and she started reporting it at the beginning of the year. So she's already had a head start on the data collection, and we're looking at a way to be able to properly convey the progress of this KPI. Again, that will be presented in September. For strategic project number 5, the governance review and modernization, we have 3 that we're going to be reporting on. Council is supported with respect to readiness to change. The second one relates to the orientation education materials. And the last one relates to the new governance committee, how it's established, and they were focused on competency-based approaches. And lastly, for the practice models in corporate dentistry, we're going to be looking at progress toward reporting on progress developing a white paper on dental practice models, including the corporate practice models. So again, this is just a high-level show of it. We're going to be populating with numbers. This is going to look a little bit differently. We wanted this to be a placeholder so that council members will be aware that it is the combination of the status updates provided within the council materials, as well as what they're going to be seeing in the dashboard, which gives a more holistic approach to how we are approaching and how we're reporting on each of the strategic projects. I'm going to pause there, and I'll hand it back over to Hannah.
Thank you very much, Eric. I am aware that we do have some guest speakers waiting in the wings, but I would like to give council the opportunity to either ask a few questions of Andrea or Eric, or make some comments should you choose to do so. Dan.
Hanno, I'm happy to go with a couple of questions now, but I also want to say that we might find some extra time before lunch if we want to return to this and ask further questions, because I know there's a lot of important information presented and more to come in September.
Okay. I think that's very reasonable. Judy.
Yes, thank you. And thank you for the presentations. I found them very helpful and informative. And I want to harken back to something that I may have raised in September, but when I think about it, I don't think I really did. I was a little surprised that the strategic plan itself came forward for approval without there having been any sessions for input by council members. And you may have, I don't recall whether you sought participation in some other way, but there wasn't a workshop where the plan was sort of floated, and there were opportunities for council members to provide some feedback and perhaps maybe even some interesting new directions. And so I'd like to understand on a go forward basis whether there will be any opportunities for that, because I think it's a very important part of developing what should be an aspirational document and not just one that provides for standards and implementation.
Thank you, Judy. You know, if you're okay, I'll respond, and then Dan can
Please
certainly.
Please do.
Yeah, thank you. Judy, thanks for the question, because it gives me a chance to highlight a couple of steps that we did take. We consulted with the profession, with the public, and with all of council back in January. So council approved the strategic plan in September 2022. We started our work on that in January of that year. And it started with a big picture issue-based consultation where we got direct feedback from council and a number of other stakeholders, including the entire dental profession, on the types of priorities we should be setting, what areas we should be focusing on, areas of importance in dentistry and regulation. That took place over the winter. And then in March of that year, so March 2022, we did a dedicated workshop session at council to get further feedback from council on areas of focus We then used all of that feedback to draft the strategic plan. We brought it back to council for input and then consulted again on the draft strategic plan over the summer. So that was last summer. And again, the entire profession was included in that process. The public was. We went to the Citizens Advisory Group. All of council were included in that, as well as our RCDSO staff. So we got additional feedback on the strategic plan in the summer. That informed revisions to the strategic plan and brought us forward to the version that came to council in September for approval. So I hope that gives you some foundation.
It does, but I'd just like to also say that, and I was going to address this in my feedback comments today, is that the format for providing input at these council sessions is very, very limited. It's not really a forum for, quote, discussion as much as it is for throwing one's comment out there and seeing where it lands. There's no, the chair, for example, isn't going to ask anybody if they have any comments on this issue. We're just going to go to the next person. And so I think that as a council, and I'm not speaking to you and specifically, Andrea, I'm just saying that as council members, I think that we should start to think about how we want to have our own meetings run, because I'm not finding this very satisfying at times. At times it is, but on specific issues, it's not satisfying. And nothing I'm saying is this should be a surprise to Dan or Harinder. So I'm not. They're aware of how I feel about this. But in any event, I'll hand it over to the next person.
Thank you for your input, Judy. Next on my list is Osama.
So I just had a question in regards to so thank you, Eric. Another great presentation. I think so if you look at the college standards, like you gave an example, one of two college standards, it's on page 101, quantitative metrics and measures. So number of standards under review is indicator 1. Indicator 2 is number of standards approved. So from what I gather here is this is just based off of meeting a quantitative measure. So basically we update a standard, or we review a standard, and then we move on to. But what about is there a priority in terms of which standards we are looking at? And I think this kind of touches on what Judy's, she's kind of saying is, are we just meeting the requirement? Yeah. So are we just mentioning the standards and we just saying, okay, we've done 20 and then that's like really good. We did 20 of them and then it's like, check next one with 25 next, and then that's going to be the KPI measure? Or is it based off of some sort of qualitative measurement that we have in terms of what's priority, for instance, like sleep apnea or TMJ, and then that would be great too in terms of like how we can prioritize those items from a quality standpoint and what really does affect the public. I hope I've been clear.
Yeah, you have. I'll hand it over to Dan. I just want to make one comment saying that the policy team has actually developed, and I think this speaks to your point, they've developed a standards review prioritization tool. And this is something that Cameron had, who's head of the policy department. This was reviewed by the quality assurance at a special meeting in May. And I believe the tool is going to be presented at a certain point. And the idea behind this was that it was used to help assess and prioritize the sequence of standards and the resources required for it. So this might relate to guidelines and practice advisors. So I'll hand it over to Dan, but I just wanted to put that out there right away.
Dan?
Yeah, thanks. If you could stop sharing screen, maybe. Osama, I think, yeah, I was going to make some of that point as well. You're going to hear today about the some of the work that's happening with respect to standards that's not quantitative. It's how we develop, or how we've proposed to develop, which ones we will choose, how will we go through that process to look at what are risky issues for patients, The point I want to make, though, is you will see sections in every agenda about the strategic plan, but several or many of the topics that you will talk about now in the last year going forward are also part of the strategic plan. Today, we're going to talk dedicated discussion around the governance committee. That's part of the governance project in the strategic plan. Today, we're going to hear a presentation about standards and how we develop them and what the risk framework can look like. That's a separate session, but that is part of the project on the strategic plan. So I think Judy's points are important. I think we have to probably move after Harinder to our guest speakers, but I think we should come back to this when we find some time on this agenda, because I think there's, we want to make sure that council as a whole is comfortable moving forward. And we want to make sure that we have enough time to do the business that council has to do. So I'll stop there and Hanno, turn it back to you.
Thanks, Dan. And Harinder, you're the last person on my list.
Thanks, Hanno. And just responding to Judy's comments. Thank you very much, Judy. We spoke yesterday about it. And Dan and I have spoken. There will be some opportunity probably in September meeting, because we are meeting in person. Hopefully we can meet the day earlier in the evening and have some discussion on your concerns. So rest assured that your feedback is being taken very seriously. Thank you.
Thank you all. At this point in time, I would like to move on to the next item on the agenda, which is a presentation by the Ontario College of Pharmacists. And I'm going to turn it over to you, Dan, and ask you to introduce them, please. And Harinder, just ask you to lower your hand, please.
And thank you, Hanno, and to Shenda and to James. Apologize for running a little bit late, but very pleased that you are able to join us today. This session is really about building council's awareness of some of the different models that are happening in governance in Ontario with other health regulators. And Shenda Tanchek and James Morrison from the Ontario College of Pharmacists are here to provide you with some information about a couple of different ways in which they've looked at their electoral districts as a college, and also separation of committees and council. Shenda Tanchek is the registrar and CEO of the Ontario College of Pharmacists. Her regulatory career is spanning more than 25 years. She served in leadership and consulting capacities. Prior to joining OCP, she was the registrar and CEO of the College of Physiotherapists of Ontario, and she's also done extensive consulting across the country. And James Morrison is joining Shenda. James is currently the chair of the Ontario College of Pharmacists board. He's a pharmacist with experience in community pharmacy practice and ownership, in consulting and research, academia, and leadership. And he's also the director of pharmacy excellence with Whole Health Pharmacy Partners, which is an independent pharmacy banner with over 200 locations from coast to coast. He's held leadership positions in several pharmacy organizations, including the Ontario Pharmacists Association and the Ontario College of Pharmacists. So Shenda and James, thank you very much. I'll leave it with you in terms of your presentation and whether you're sharing or we are going to organize that, and I'll turn it over to you to hear from you. Thank you.
Thank you very much, Dan. I believe, Shenda, you've got the slides. Oh, there they are. So before I start, I just want to acknowledge I'm actually in Winnipeg today in a hotel at a conference, and I'm hoping the internet will hold on. It actually just booted me. So Shenda, if you lose me, please continue and I'll rejoin. And I'd just like to say that Winnipeg is the ancestral lands of Treaty 1 territory and the heartland of the Métis, and it's a privilege to be here presenting to you all from Winnipeg. As you know, we're talking today about governance revision within the constraints of the RHPA. And at the OCP, we were able to move a lot of aspects of our governance within those constraints. And I'm excited to talk to you about them today. Shenda, could you go to the next slide? All right, so this one describes the journey we're going to go on today, where we move from a council to a board. And this took place in 2019. And starting from the left side there, this involved a number of changes at our council, which is now a board. We reduced the number of the size of our board from 17 elected directors down to just 9 in one foul swoop. We separated the board and the committees as much as we possibly could. There's still that constraint in the RHPA that board directors, elected board directors, have to serve on discipline. So we're still coping with that fallout. It makes it a little bit challenging to form all the discipline panels at times, but we've been getting by the last few years. Board composition. So the balance of professional and public directors became level, reduced the number of professional elected directors. We're going to talk to you about our competency-based screening and election that we have for our directors on the board. And all these changes also involved a lot of changes in the language that we use. So some of the key ones are we move from a council to a board for language. Members, we no longer call members because there's an impression with the word member that you're entitled to certain benefits being a member. So we moved to use the word registrants quite seamlessly at our college. And it also involved changes in titles. For example, president is now a chair, vice president is now a vice chair. And there may be others. Shenda, if you want to ever jump in, feel free. I know you're there in the ether somewhere. But, it was really wonderful to be on the board at the time. And long before 2019, I was there leading up to that period as well. And what really helped our board with the decisions we were making was the volume of information and presentations, much like this one that we received ahead of time to prepare us and help us understand what we were doing and why we were doing it. I've talked to some of my fellow council members at the time as well to understand how it was that we moved through that process relatively seamlessly with all hands on deck. And, they spoke to being very persuaded by the evidence we were presented around best practices. And this was the right thing to do for OCP. And folks were able to put aside their personal interests to, in fact, vote themselves out of the council and have to run for an election in order to come back to the board. And even one of us who was strongly supportive of this, because of changes we made to separate service on advocacy groups with a period of time, a cooling off before you could come back to our board, she actually had to step away for a couple of years before she would even be eligible to run again. So the evidence was so strong that folks were willing to stand aside to let this move forward. Shenda, next slide. So this one here describes some of the changes we made to our election, and there's more of it on the details later on in the presentation. But we moved to a brand new way to select candidates for election in our 2019 election, and we've had a few more rounds since then. An important aspect of that was eliminating geographic districts and introducing diversity and skills requirements. So it's not just an election, it's an application. It's almost like applying for a job. When you apply for our board now, there's many questions about your background and experiences and understanding, does the person applying comprehend the college's mandate in the public interest to regulate pharmacy? And also, assessing diversity in the applications and removing postal codes. So we used to elect by postal codes, and now it's province-wide. We also used to only be able to vote if you were in that postal code. So now I find having province-wide elections, it actually engages the registrants more with the college every year. So now they're not getting called to vote every 3 years anymore. It's every single year there are some candidates to choose because we stagger our elections. And also technicians, we regulate techs and pharmacists, pharmacy technicians, and we can vote for each other. So pharmacists can choose the technicians and technicians can choose the pharmacists. So I think it's been really wonderful that we've done that. Shanda, next slide. So we collect data on diversity of patient populations served. And you'll see later in the presentation, we have our board's annual self-assessment of this. Every year we do our own skills inventory and assessment of the diversity and the patients served. And I believe the patient populations are in our bylaws, Shenda, correct me if I'm wrong.
That's right.
Yeah, so these are the ones that were teased out some years ago as important for our board, that we wanted to have pharmacy professionals that served these buckets of populations across the province. And you'll see later that we have fairly good coverage now over the last few years when we go out and we seek in our elections at times if one of these competencies was missing, serving a particular patient group. Next slide, please, Shenda. So knowledge, skills, and experience. So we also assess when folks are coming onto the board, and also every year the current board, because we're constantly developing as people and we bring learning and education opportunities to our board, but also public directors or even professional directors might be building more competencies in their own careers outside of the board. So every year we assess, and collectively, our directors have many experiences that are required, and they're listed there on the slide. Anything in particular you wanted to call out, Shenda?
No, I think it's worth noting that both the diversity of patient populations and the inventory of skills and experience are built into the bylaws. And that might mean that over the years, they may be changed as needs change, because that's within the college's control, of course.
Right. Okay. Next slide. So we're getting down into some more details in terms of how we did this. So back in 2019, we had selected 2 of our council members to stay on the new board to provide some continuity. So we didn't want to throw out to election absolutely everybody. We wanted to hold a little bit in case some key folks didn't make it back that were, already skilled up to lead the college into the next round. So the incoming board chair, Billy stayed on, and I was expected to be vice chair soon after, and then probably board chair. So the 2 of us, we were protected from this election, but everyone else, all of the professional directors needed to go for election. So we were holding an election just for 7 positions. So we were going from a board of 17 professional directors down to just 9. So you see there, August 2020 election for the 7 board members, and then September is when our board year starts. So that was when we became a board rather than a council, with a much smaller group of people around the table. And thereafter, it's 3-year election cycles. So this slide has it in a bit more detail for you, where you can see at the first 2 bars, that's the people that we held for continuity to lead the board. So there's executive incumbent 1 and 2. So one of us had a 2-year term and one of us had a 3-year term. That was by a straw draw, like there was nothing to determine that other than random chance. But for the other positions, they were based on election turnout. So based on the number of votes. So if you were a pharmacist with the most votes, or the second most votes, you had a 3-year term, and the technician with the most votes had a 3-year term. And then those with the second most votes had 2 years, and so on down to 1 year. And that set us up to have a staggered approach with folks coming off the board. So it was never a high degree of turnover. So I think that's important for, planning, to make sure you have folks that are ready to rise into the chair of the board role or executive roles. I think it's less risky than having everyone coming off and then coming back potentially with all new folks around the board. So I think that's very important. Next slide, Jenda. So just a little bit more on why it's important to get rid of geographical districts. And I really strongly believe that this made a big difference for our board. It really restricts you to go out with particular competencies to identify folks eligible for election if we were restricted just to one arbitrary postal code each year to try and bring the best candidates through to the board. It reduces the perception to a degree that the board members represent the folks that are voting for them. And this is something that I still think we're struggling with a little bit, even though we busted down the postal codes and it's province-wide election. I still think that there's a misconception among some registrants that it's like a political election where they vote for a candidate and they can influence that person in a way, but that's not the case. So I do some education on that when I get approached by registrants asking for particular things they're interested in or support on particular matters at the college. And it gives us access to the whole province for the pool of candidates, which can reduce pressure associated with running against folks that you might know in your own postal code. It actually gives more opportunity as well to be elected. So maybe there's a lot of competition this year, but then there'll be another opportunity the year after. So you don't have to wait for your postal code to come up again if you're seeking election. And anything else? So no need to wait yet. So, and then also more flexibility with the competency-based screening. So we can, any year, if there's a gap in our competencies, we can go out anywhere in the province to fill that. So it's been a lot of positives for us in doing so. So Shanda, I think you're going to cover off the next bit.
I am. Thank you, James. So I think that we've covered a little bit. When I call it competencies, I'm including both that skills piece and the patient demographic representation. So competency is kind of a bad word. It doesn't really embrace both of those, but let's use it as a proxy. And I wanted to tell you how this actually works. So as James said, there's a board skills inventory that happens at the beginning of every year, and that is a self-evaluation. Board members understand that they're reflecting on their own skill set and evaluating themselves. That information isn't shared with everybody on the board. You can see your own inventory compared to the aggregate at the end. That's private for you. But what we get from it, I'll show you, or James will show you in a few minutes, is this report about where we're strong and where there may be gaps on the board. The governance committee reviews that, looks at the collective piece, and figures out whether there is anything missing to make good board decisions. It develops a director profile for the election that may identify those specific gaps that we're recruiting for. The communications to registrants talks about the number of positions up for election, shows the director profile. So this year we're really focusing on IT skills. That's not true, but that might be what it would say. And then there's the application process. And again, as James said, that looks like a job application. Then a screening committee reviews all those applications and notifies candidates if they are not eligible or if they are. So the board skills inventory, I'm going to turn it back over to James to describe this year's self-evaluation.
Thank you, Shanda. So we don't have an example of the questions in these decks, but on each of these areas on this heat map, there's a scale where it's very specific language used to help all of the public and professional directors assess their own competencies. So we ask a number of questions. Not all of them, I would say, are competencies. So example is availability is not really a competency, but more of a requirement if you're going to be on the board. And you'll see that, we had some strengths and some areas where there's opportunities. So for example, cybersecurity. That's important for, mitigating risk at the college, but we didn't think this year that we should go out for an election and try and find a pharmacist with cybersecurity competency because it was unlikely to be successful in doing so. So we could have done that, but we chose not to. In the past, we have gone out and included some of these competencies in the description. Like ideally, we would like registrants with these competencies to come forward, but we didn't specifically hold a spot for the competency. We do use this assessment to identify areas of learning opportunities for our board. So for example, last year, we learned that we weren't too strong in financial governance. So we arranged for financial training for the directors that were interested to enhance their understanding and their skill in that area. Next slide, please, Shanda. So we also ask about patient populations served by our elected directors. And we have in the past, when we identified a gap, I think the language is rural remote. My monitor is very small here, but yeah, remote northern areas. So we actually held a spot when we went for election that one of the professional directors must serve patients in rural remote settings. So we were able to use that lever to bring someone in an election process where otherwise we would have no control. We could hold a spot for someone who serves that patient population. And we were able to bring that experience onto our board. I think that was 2 elections ago. Great. So this year, we didn't identify any specific gaps when we were at governance reviewing our competency profiles. So we went out to election this year. Our call for election didn't include any specific competencies, no specific emphasis. Shanda, over to you.
So I think that as they always say, the devil is in the details. So how do we actually make this real? And I think this next step about our governance committee reviewing the collective skills and identifying the gaps, as James has said, this year they didn't find any specific gaps, but let's look a little bit at how they might do it. So they do look at that board skills inventory, identify the gaps, and determine the competencies. Then they go out for this advertising, and this is just what it looked like from this year. So it's pretty specific. Theoretically, the number of positions could change. The qualifications that we were looking for could change. And we tried to kind of go out broadly in terms of drumming up interest. And here's the magic, I think. So I want you to know I've been at this college for 1 year. And as Dan said in my bio, I've been around the block a few times and I've worked with a number of regulators. So Obviously, I'm biased. I like where I work. My boss is on the line, but I'm here to tell you that I find this to be the highest functioning regulatory board that I've ever worked with. It could be that pharmacists are just smarter than all the other health professionals, but it actually might be the magic of this process. So we have this screening committee that fascinated me when I was doing consulting work about governance models. It includes the chair of the governance committee, 2 of our board members, 1 who has to be a public member, and 2 external appointees. And here's what the process looks like. So first of all, just as it would happen at your shop, staff screen for the basic eligibility stuff. So that's somebody who's actually a registrant. All of those things are pretty common between the colleges. The next thing we do is engage external governance consultants who go through those applications that are part of the submitting for candidacy process. And they review them and they rank them. And we've just received this year's consultants report. And so I threw that quote in there because I think it's really valuable and may help explain why I'm finding this board to be so high functioning. What the consultants are saying is that each year they're even more impressed by the quality of the applicants. That's pretty exciting in terms of the confidence we can have in the decision-making capabilities around the table. The screening committee gives this report to the governance committee. The external consultants give the report to the screening committee. And remember that there are 2 external individuals on the screening committee. They may require an interview to clarify any ambiguity that the consultants found, and they select the qualified candidates. I'm going to give you another quote from this year's report from the consultants, and that said, they said, the pharmacists under consideration demonstrated impressive knowledge, participation in the community, and diversity of individuals and practice areas. The top 6 were well qualified for immediate board service, and the following 3 for future consideration after experience on a committee. So baked right into this process is succession planning. If somebody has almost all the skills, but maybe they're missing some financial management skills, or maybe they don't have any board experience, then we can target them for recruitment to serve on one of the committees. It's an intricate puzzle because the separation of the committees from board service means that we have lots of vacancies at the committees, and that too looks like a complicated, or not complicated, it's not complicated, but it's detailed application process. So that same screening committee is applying applications for committee reappointments and makes those recommendations to the governance committee. And those who aren't qualified to stand for board election, they get to have that conversation about where they might build up. So maybe they aren't even yet qualified for committee selection, but we'll talk to them about what they might do to fill in their gaps. So here's where we land today. We have 9 elected registrants and 10 public members, and we have 2 academic appointees. As it happens, one of those is a pharmacist and one of them isn't. We have a new pharmacy school coming on board in September at the University of Ottawa. Their dean will automatically be on our board, and he is not a pharmacist. The other thing that I think is really interesting and different about our bylaws is that they permit us to increase the number of elected members should the balance tip in favor of public appointments. We had a board meeting on Monday where this very issue came up because, as you can see, we've got 1 more publicly appointed member than we have elected registrants on our board. And the board talked about it for a pretty long time, and they ultimately decided that keeping a small board was more important than keeping an equal number of registrants to public appointees. And part of that was informed by the impossibility of maintaining an equal balance because the public appointment system isn't at the same cadence as our elections are. But it was a interesting conversation, and that's where they netted out. And that is the end of our presentation. I'm going to turn it back over to James, and we're happy to answer any questions as best we can.
Yeah, thank you, Shenda. And one comment I forgot to mention is there's sometimes our directors get confused when we do our skills assessment and might want to overestimate their personal skills because they feel that they need to rank highly. But we're not looking at any individual director's skills. It's to assess the skills of the whole group. And it's not helpful if someone's exaggerating. So we ask them all to be honest. And it's okay if you're a 1 on some things and a 3 or 4 on others. It's perfectly fine. It's just the aggregate we're interested in. So we're happy to take questions. I think with Shenda, we have a tremendous asset in our registrar. And I'm so grateful that she applied when we hired her last year. And very happy to share her with you all this morning. So
thank you both for that. I am aware that there are some people on my list. I will continue to keep a list. And we do have a few moments, Council, before we take our morning break. So I'm going to start with Ram. You were the first person on my list.
Thank you. Great presentation. My question is about self-evaluation of the board, that particular area. There was one item, how you evaluate the public interest, if you can elaborate on that.
Yeah, Shenda, do we have the question handy?
Sorry, no, James.
Yeah, that would have been helpful because it's been a while since I've looked at it. But it asks, there's tiers, and it asks questions. I believe it was, I have a strong understanding of something along those lines, Shenda.
Yeah, and I think that it's not foolproof, but it intends to, again, it's a self-declaration to ask people if they have a clear understanding of the role and mandate of the college and what it means to serve the public interest. I'll just see if I can pull the exact question, but I'm not sure we'll be able to move that quickly.
Well, in light of the fact that there are a significant number of people on my list, maybe what I would suggest is if you can do that, that's great. And then I will go back to you, but I think we do need to still continue moving through our list. So next on my list is Nalan.
Okay. Well, thank you, James and Shenda, for coming and sharing this information. I just have 2 questions. After you went through this governance reform and conversion, question number 1, do you feel your board is more responsive, effective, and efficient? And question number 2, after this whole process, is there anything you would have done differently?
So James, let me jump into that first one as a sort of still objective outsider, and then if you would answer the second one about doing things differently. So now this thing that I noticed that made this board distinct was maybe efficiency, and that was that each person makes a meaningful contribution or is silent around the table. So I've often watched boards where every single person needs to speak about it, every motion that's brought forward. This one's a lot more precise. And the level of preparedness that people bring to the table is unprecedented in my experience. It's very rare to have anybody around the table who hasn't thoroughly thought through the materials. So I think that the application process reminds people that this actually is more of a job than a volunteer opportunity, and people really bring their performance best to the work. It's hard to measure. I don't have KPIs for you at hand, but that's my observation.
I could probably talk about this for quite a while, but I'll try and be concise. The difference in how our board operates in 2018 versus today is incredibly different. You wouldn't think it's the same regulator, honestly. At the time, we would spend a lot of time trapped in conversations that would go in circles and circles and not come to a decision. And a lot of folks repeating themselves and repeating what other people said. It was a tremendous waste of time. And it was very frustrating to be a new director or new council member on that board at the time. We also had more people around the table who didn't have a clear separation of their advocacy hat and their regulation hat and the public interest. So our screening and selection process has actually filtered some of that out and give us more control. I don't know what I would have done differently. Like we still have some constraints that stop us from further evolving how we govern at OCP that's in the RHPA. Like, I think we prepared our board as much as we could, and it's still at times when you're making a decision that's against your own interests, it didn't really feel great for you personally, but you knew you were making the right decision. So I'm not sure what we could have done differently.
I'd vote for having another look at the skills. I think one of the other things that's changed is it's a very, very clear understanding of what's operational and what's policy governance. And I think some of the skills in the skills inventory reflect more operational board. So for example, the one, that cybersecurity one, it is hard for me to imagine why we need a board member with expertise in that area, as long as we can assure the board that we have internal expertise in the area. So I think we will re-examine those in the coming years.
And thank you, Nala. Did you have a part 2 to your question?
No, that's good. Thank you.
Thank you so much. Next on my list is Anthony Mayer.
Hi, thank you, James and Shanda, for a very impressive presentation. I had just a really quick question. Near the end, you mentioned that you now have a small board at 21 members, and it sounds to me like 21 is still kind of big. And I'm wondering if there was any consideration given to what is conventionally now considered the optimal number of 10 to 14. Thank you.
So I'll say, like, we can't go any smaller based on the RHPA, but Shanda, I don't know, in your experience, what would be the ideal board size for a regulator?
Well, I think 8 to 12 is sort of the best practices for board size. And our board, in the consultations that happened a couple of years ago by the Ministry of Health, have requested that the change that would enable them to reduce their size further. They also asked to remove those academic appointments. I say they because I wasn't there at the time, but again, to reduce the board size and have a little bit more management over the fairness element for pharmacy technicians, since pharmacy technician colleges don't have representation at the board.
Thank you. I have 4 people left on my speakers list. Judy, you're next.
Thank you. And thank you for a very interesting presentation. I had a couple of questions arising out of some of the materials that you presented. I was particularly interested in I think it was James's statement that you hold a spot for specific competencies. I'd like to know what that looks like. Is that a situation where you've gone through they've all been screened, there's a set of competencies that you're looking for and nobody has them, and so do you go out and find somebody and solicit them for the board, or what do you do?
Good question, Judy. It's part of the call for election. So before we even looking at the candidates that are applying, so we'll say this year we need to elect, 2 pharmacists or 3 pharmacists and 1 technician, and there's 1 spot reserved for someone with this particular skill or patient population served. So operationally, Shanda, I'm not exactly sure how it happens on the back end, but we look at whoever applies and they get siloed. I don't know if we do that after the votes come in. I think we do. As I recall, folks voted, and if the person who had that competency was already to the top, it wasn't an issue. But if they fell below the cut point, I think they got bumped up to be elected.
So I think the external consultants in reviewing the application and ranking the candidates would they're very well aware of the competencies that we'd be looking for in any given year. So in the year, for example, that we were looking for somebody who served remote or northern communities, that person, if there was only one, would have been ranked number one. That doesn't mean that nobody else might be in that election and the results of the election wouldn't be manipulated, but it could mean nobody else would be in the election. If you remember the graph and the spider graph that James presented, it showed that we have at least some skill right now in the 2023 board in every area. So it's not desperate that we find anyone with specific skills. But if there was a complete dearth of skills, let's just pick Indigenous service to Indigenous populations. I think that if we had nobody on the board that did that and we had only one applicant, it could be that the screening committee would decide that that person was the only person eligible. It hasn't happened, Judy, but theoretically it could go that way.
So in other words, the election process isn't necessarily as open as one would expect.
It's not. That's the whole point of screening for competencies. So some people are told they can't run for election because they don't have the competencies necessary to serve the board. Do you want me to circle back now to the public interest questions? Because they have them in front of me, if that would be helpful.
Please.
So there are 5 questions. One is whether you were are or were chair or CEO of a regulatory body with an annual budget in excess of $100 million, or chair of a government legislation committee. Obviously that one not going to get too many ticks. Direct involvement in the creation or implementation or monitoring of a regulatory agency or government body. Experience as a board director of a regulatory body. Other experience with the principles of protecting and acting in the public interest, and awareness of the principles and of protecting and acting in the public interest. So you'd fill those in, you'd check each one that applied to you, and they are ranked. So if you have awareness but no experience, you get 1 point. If you are Dan Faulkner, you're going to tick off that you have had that previous experience and you're going to get 5 points.
Thank you for that.
Okay.
I have 3 people left on my speakers list. Nancy, you are next.
Thank you, Hanno. I really wanted to say thank you for your presentation, James and Shenda. So informative. I don't have a question, but I merely have a comment. And I just wanted to share that I feel that the changes made by your college appears to have resulted in better governance, better public perception, better board composition because of better quality of applicants, and what a great exemplary model to follow for governance modernization. And I really want to thank you for sharing. Thank you.
Thank you, Nancy. Jamie?
Yeah, once again, thank you both for your presentation. Just a point of clarification. I presume that the skills and competency tests were applied to public members, correct?
Of course, we don't have control over who's appointed, but we have conveyed the information to the Public Appointments Office.
Yeah, okay. Would you like to see that aspect changed in terms of how public members come to be part of your board?
Oh, Jamie, I dream big. I would love to see us sharing public members between colleges, and I would love to see competency screening. I mean, theoretically, I think that does take place, but the colleges have so little input into what the competencies would be. So we are lucky in our public appointments right now, but I've certainly served on or worked with college councils in the past where that hasn't been the case.
Yeah, and just a follow up, when you talked, James, about the need for the board to have some financial training, was that financial training related to the finances of the college or their own particular practices?
Probably both, but I was specifically talking about like our oversight role and understanding financial statements for the college so that when we're getting those updates, so we can wrap our head around the numbers.
Yeah. Thank you. And the last person to speak is Anthony Lishko.
Congratulations, Shenda and James, on what you've accomplished. It is amazing. I'd just like to share that I chair a board of a small trust company out in BC, and we have been doing board self-evaluation for the last 4 or 5 years. And it's an amazing process. We have a small board. There's only 7 board members. I also like to say thank you, Jamie. That was a great question on the public member process, and perhaps that should be duplicated, as Shenda just alluded to as well. The other one point briefly I'd like to share is that I have just gone through that process that we've all described here. I went through a competency-based appointment process. Because there was no one in the particular district that I represent, I went through the process that's been described today, albeit it was onerous because I had never really done that before. But at the same time, it was also rewarding and sort of inward looking, like why should I be there, and what competencies do I have to make myself perhaps contributory to the position that I'm looking for. So it was a great experience. I was interviewed by 3 different colleges, health professional colleges, and like I said, it was rewarding, and I think it's a great way to proceed. And I hope that we've had one experience, me, so hopefully we can go on from that. Thank you again, Shenda and James.
Our pleasure.
Thank you, Anthony. And Dan, I'm wondering if I can just turn it over to you now.
Yeah, thanks, Hanno. James, Shenda, thank you very much. Obviously, our council, like yours, has been on a journey of governance and making changes and learning from others, and really appreciate what you've offered council. And you can tell by the number and quality of questions that there's great interest in moving forward and really applying what works and continuing to work collectively to make sure that we are addressing these issues. So I want to thank you very much for taking time out of your busy days, and James for joining from Winnipeg.
Glad to be here. And just to follow up, Anthony, if I could, I would do away with elections altogether and just have competency-based screenings. We have an election selection and it's still tricky. So there's still room to grow, I think.
Thank you again, James and Shenda, for joining us. Thank you as well, Council, for your thoughtful questions and comments. I'm going to suggest we take our morning break now. It's going to be a 15-minute break. When we come back, I'm going to also suggest that we continue on with our presentation, and then we will go back on the agenda following the presentation to look at the polling that Dan would like to do. So it is now 11:04. I would ask that we take a break until 11:19, and please mute yourselves, turn off your video cameras, and at 11:19, we will reconvene. Thank you.
One vote.
Hi, Marie. I just want to remind you that we are live streamed to a public audience. Just, it's important for our guests to remember that when they're doing their presentation.
Thank you.
All right. Sorry, we're running a little bit late, but thank you if you're able to stay a bit beyond what we had talked about.
I think we have the majority of people back online. So what I would like to do is move to the next item on the agenda, and that is going to be a presentation regarding the National Dental Examining Board of Canada. And I'm going to ask Dan to make the introductions, please, for this presentation.
Thank you, Hanno. And Council, I'm pleased to introduce Dr. Marie Dagenet, who is the Executive Director and Registrar of the National Examining Board of Canada, the NDEB. And Marie has been the Executive Director since 2018. Prior to working for the NDEB, Dr. Dagenet spent 27 years at McGill University teaching oral and maxillofacial radiology, and she was the Associate Dean Academic Affairs for 12 years. And she's held several positions in various national organizations. I've asked Marie to talk to you more generally about the NDEB. It's certainly an organization and a topic that's come up in a number of different ways for this council. And I'll turn it over to Marie to give you a brief overview of the organization, what it does, and some of its current challenges and directions.
Thank you, Dan, for inviting me. And thank you to the board. I recognize the importance of the relationship that we have, and I'm pleased to share information about the NDEB. We'll share my screen. Can you see my screen?
Yes.
Yes. Okay. There you go. Oops. Just go on the first slide. There you go. The outline of the presentation is as follow. They're the topics that I was sent. So an overview of the organization, the importance of the working relationship between regulators and the NDEB, changes that we've made over the past 3 years, and some challenges that we face. First, it's important to remember that the NDEB was created in 1952 through an act of parliament. And our mandate is to establish qualifying condition for a single national standard of qualification for dentists in Canada. And that standard today is passing the virtual OSCE. And we issue certificates to those who meet the standards, and the certificates are required by the regulators for licensing. Our mission is to contribute to the oral health of Canadians by providing a fair, valid, and reliable evaluation of competence for the certification of dentists. And we strive to follow our missions in everything we do. We have agreements with the regulators in all provinces. So we have agreements regarding general dentists. We also have agreements regarding specialists, and all provinces have agreed to use the certificates given by the NDEB to require the certificates for licensing dentists and specialists in their provinces. All NDEB examinations, whether we talk about general dentistry or examination for specialists, are designed to assess whether a candidate has the knowledge, the skills, and the abilities to practice safely in Canada. And we do share with the RCDSO the concern for the protection of the public. We base our work, our examinations, whether it's the development of the examination, the administration of the examination, or the grading of the examination, on standards. So we're guided by standards that were developed by the American Educational Research Association, the American Psychological Association, and the National Council on Measurement in Education. So these standards are followed by all examinations like the NDEB, and they basically guide everything that we do. The exams are based on competencies that we have established, so right now we're using for general dentistry the NDEB KSAs for knowledge, skills, and abilities. These KSAs were developed in 2014, I believe, by educators, regulators, members of the Commission on Dental Accreditation, and the CDA. And these KSAs are actually aligned with the ACFD framework for competencies that is used by Canadian dental programs. And we are awaiting the new competencies that are being developed and are close to being finalized, that that are being developed by CDRAF. So all our general dentistry exam are based on these competencies, and the amount of the competencies were validated in 2015 through a survey that we sent to all Canadian dentists. So all members of RCDSO would have received a survey, and basically they were asked to rate the importance and frequency of each competency. And if dentists overall rated the competency as important and said they practiced it frequently in their practice, it would have more room on an examination. So we establish what is the minimally competent performance, and we standard set our examination to ensure that the dentist that is minimally competent will pass the exam. So the exam are not established to test excellence, they're established to ensure that the minimally competent, so the person at the lowest portion of the spectrum of competence will pass the examination. And a person at that level would obtain a result of 75 on the examination, but 75 does not mean that they passed 75% of the question. It means that they actually met the passing standard that was determined, and it's determined by a group of experts that is diverse. There's representation from all provinces, there are academics, there are dentists in private practice, etc. So these experts determine what is the passing standard, and that passing standard is rescaled to a 75 passing standard. We have representative on the board from the 10 DRAs, plus 2 representatives from the Commission on Dental Accreditation of Canada, as per the Act of Parliament. And we more recently have added a public representative. We have, in addition to the board, 5 committees that are responsible for specific areas of governance of the NDEB. And of course, one very important committee is the examination committee. And this committee also contains examiners with expertise in examination and testing. And these committees report to the board at the annual meeting. We have currently, I would say, 4 exams or 4 processes. We have the certification process through the virtual OSCE. We have the equivalency process for dentists trained in non-accredited program. And this consists in 3 examinations: the AFK, Assessment of Fundamental Knowledge, the ACJ, Assessment of Clinical Judgment, and the new exam, the NDEC, which is replacing the ACS, Assessment of Clinical Skills. We will be offering the NDSC in 9 specialties for the 4th time soon, in a few weeks. In June. So this is going to be our 4th administration, after which it will transition back to the RCDC. And we are also offering a small admission test called the DISCI, Dental Specialty Core Knowledge Examination, for entry into the university training program for specialists trained in non-accredited programs. So the changes we've made in the past 3 years, our strategic plan, which is close to completion for the period 2019-2024, had 4 key result areas, and each column that you see is one of the key result area. The first one was the transitioning all paper and pencil examination to electronic delivery. And we have completed this in the past 3 years. And the second one was to review the equivalency process blueprint, which we have also completed in the past 3 years. As I mentioned, we ran the specialty exam, the NDSC in 9 specialties for 3 years, and we're about to run our 4th series of examination. The RCDSO has recently announced the nomination of a new director of examination, and we will be working with the RCDSO to transition the NDSC to them, and we actually have a meeting scheduled on June 22nd with the RCDSO at our office to actually work on the transition. This key is going to be eliminated. It used to be a requirement in the CDAC requirement for DSATPs, but it's been removed as a requirement last fall. And faculties of dentistry, Toronto is the biggest program for DSATPs, will be able to choose the admission criteria of their choice to select their examinees. So we will no longer offer the DISC-key. The last administration will be in September. After that, the schools will have other options. There is an American test that is actually similar and that we believe is quite interesting. Another big change that we made in the last 3 years is to review the equivalency process and to open a test center at the NDB for our new examination. The NDEC, replacing the ACE, is also a 2-day examination. 1 day is a clinical skills component that has requirements that are the same as those of the ACS, but there are less requirements. And on the second day, we have, it's a half-day exam that we call the situational judgment component. And this examination tests the following 5 domains: patient-centered care, communication, health promotion, practice management, and professionalism. There was a lot of work and efforts into the development of this component. It was partially done at the request of the regulators to expand on the domains of competency that we test for dentists trained in non-accredited programs. Now I'm going to move into the challenges that we've had. And I will start with actually the challenges with that new examination. The addition of the new component has resulted in a lower pass rate for the NDEC compared to the ACS, and that has brought a lot of criticism. The clinical skills component has a pass rate for the examinations that we've done in 2022 of about 40%, which is comparable to the pass rate for the ACS. It's by adding a new examination, testing new competencies. That examination has resulted in an overall pass rate for the NDEC that is lower than for the ACS. And we are reviewing the blueprint. We are reviewing the requirement. We've met with CDRAF last week to discuss the NDEC and the changes that we have made. And we're really committed to work at offering the best exam possible that will meet the needs of the regulators and of the profession in Canada. Another challenge that we have is exam capacity. The pandemic has been difficult because we had challenges with the public health restriction to offer enough seats. Now that the pandemic is sort of behind us, we continue to have challenges, and the reason is because we of the electronic conversion. We have partnered with the biggest provider of testing centers in Canada, but they're not able to offer us as many seats as we need for the AFK and the ACJ. For the AFK, because of this, we have continued to offer exams on paper. The exam is a standard multiple choice examination, so it can be offered on paper. And we're offering it both on paper and electronically in testing center. The ACJ is an examination that tests clinical judgment, clinical decision-making. And for this examination, we use a lot of pictures and images, and the electronic format is important. We don't want to go back to a paper examination, and we are very limited in the number of seats that we can offer. And this is why for the virtual OSCE, we have moved to a different model. The virtual OSCE, the certification exam, the first offering was in March of this year. And what we did is that we partnered with hotels and convention centers. For the sites, we partnered with a technology provider for the computer and for delivering the exam at the testing centers. We also use a company to provide the invigilators. And we have actually a fourth provider for the exam platform. And last March, we had some slowdowns at some of the centers that were actually caused by the fact that the maximum capacity of the server of the exam platform provider was reached during the exam. The exam was delivered over the internet. And so examinees had slowdowns, and it was very unfortunate because we'd put a lot of effort into delivering the exam electronically with this new, I'm going to say technique. And we would have hoped for this to go very smoothly. As a result, we have just offered the June examination in a slightly different way. We have not used the examination platform that gave us problems in March, although we would like to go back to this because the platform is nicer than the way we offered it in June. It's presented in a nicer way. It's easier to navigate for examinees, but we didn't have confidence that it would work smoothly. And some of the people that took the exam in June were the same that were not successful in March. So we wanted to have a smooth administration, and we did. Challenge for us is to be able to deliver that examination using the NICE exam platform in the future. And that will sort of complete my presentation. I'll stop sharing, and I'm pleased to answer questions.
Thank you very much, Marie. So at this point in time, I will scan council to see, and I see Daniel Haas, you have your hand up. Would you go ahead, please, with your question? Okay, Daniel, please, you need to unmute, please.
You think after 3 years I would learn how to do that? It's not really a question. I do have a comment for council. I've been involved with question development and question selection with the NDB for quite a number of years with the OSCE and the ACJ. I just want to speak to the rigor psychometrically of this process. And faculty members that take part, and faculty members from across the dental schools across Canada who take part, we all comment how our own abilities at question writing to make them valid and reliable have improved by being engaged with the NDB. And just one last comment, when I was dean, I'd often meet with my counterparts in the United States who repeatedly spoke in admiration of the process and of the NDB. So I think it's important for council to be aware that psychometrically, they are really the gold standard with respect to assessments. Thank you.
Thank you for those comments, Dan. Ram, you're on my list next.
Thank you, Marie. A very good presentation. My question is, you have something like 5-6 countries under accredited countries in your presentation. Do you have authority, or do you plan to include more countries to deal with some of the shortages of healthcare professionals?
I believe that this is something that is in the mandate of CDAC. The agreements are with CDAC. So if CDAC chooses to pursue additional agreement, we will be supportive.
Okay, thank you.
Thank you. Osama?
Hello. I have a question regarding the NDSC. Is it a complete handoff to the RCDC, or will there be some collaboration after the transition?
We have agreed to collaborate with the RCDC. Of course, how can I say? We have agreed to share our resources, share our material, share our experience. At this stage, we're not exactly sure what they will ask us to do, but I can assure you that we are pleased to collaborate and hoping to continue to be involved so that what we have built in the past 4 years, they will continue to build on that and not start from the beginning.
Thank you.
Thank you. And council members, before I turn it back over to Dan to do the official thank you, does anyone else have a question for Marie at this point in time? Seeing none and having exhausted our speakers list, Dan, could I turn it over to you, please, now?
Sure. Thanks, Hanno. And thank you very much, Marie, for attending and providing that information. And I know you only scratched the surface, because I've been working in various ways and interacting with you in many ways over the last 2.5 years or almost 3 years. And this is a very complex set of interactions between the NDEB, the regulators, and several other organizations. And you did a great job in providing some of the highlights to council. And I've obviously been working with our group to keep them up to date on a lot of the work that's happening nationally. So I do want to thank you for attending, and it's possible that we'll have you come back at some point in the future and maybe speak to some of these issues in a bit more detail. So thanks very much, Marie.
Thank you, Dan, and I'm pleased to come back to discuss more in detail certain issues. Thank you very much.
Thank you, Marie, and thank you, Dan. At this point in time, Council, what I would suggest is that we go back to the agenda to the item following the presentation by the Ontario College of Pharmacists. And I'm going to turn it over to Dan, who will take a few minutes to walk you through some polling questions. Dan.
Thanks. And I think we can do this fairly quickly. And the idea was to continue to get your feedback through a poll that will allow us to understand some of the things that you're thinking about the various aspects of governance. So I'm going to first ask for just your time in a couple of minutes to just provide you again with the results from the last meeting, where we asked a number of questions. So Angelo is showing some slides. These are the actual results from the poll that we conducted in April. And the first question on the left is your response to: I support establishing a new governance committee to oversee the selection of professional members of council and the selection of committee members. And you can see strong agreement at 83%. And as we move to the right, strong agreement and agreement at about 72% for the role of the executive committee should be reformed to increase the participation of council. So some work to do still on that aspect. But I'll carry on with the results. I support moving towards parity, so an equal number of professional and public members on council and committees, and there was about 63% of you who agreed or strongly agreed, and about 32% who disagreed. And again, you can see the actual response rate at the top. I believe we had 22 or 23 members of council at the meeting, so you've got 19 pretty consistently responses across all of these questions. I support staggered terms for council and committee members to improve institutional knowledge. Again, a fairly high agreement, about 85%. Next slide. I'm in favor of reducing the size of council to between 10 to 12 members, and that's about an 84% strongly agree or agree. And I'm in favor of separating council membership from committee membership, and that was a disagreement of about 65%. So again, another area where we will continue to provide more information and some of the experiences of other colleges before we start to look at options for RCDSO. And then the next slide, which I think is the final one. On the left, I support recruitment of non-dentists with specified expertise to serve on committees to increase public participation and add skills. We heard a lot about that this morning in terms of skills-based or competency-based elections. RCDSO itself has done that extensively in the past 2 election cycles, and your agreement was fairly high, which I suppose would be expected given that you've directed this over the last few years. Agreement and strong agreement at about 84%. And then a question that we couldn't quite make work at the last meeting, and so we sent it around in the evaluation forms. I support revisions to electoral districts. So for example, the boundaries or the designated seats for diversity attributes to strengthen competency-based elections. And you can see in the green and the top blue bar, that's about 78% of strong agreement or agreement. So again, that was the subject mostly of the presentation this morning in terms of electoral districts. So what we thought is we'd ask you 3 additional questions and see where you are on those questions, and we'll continue to make sure that we're responsive to where you want more information. So if we could have the Slido poll, you can use your phone and take a picture, and the QR code will direct you to the website, or you can use any of your devices and in your browser, slido.com, and there's the number that you would use as the unique number for this poll. So I'm going to give you a couple of seconds with this slide still up so you see it. And as you're doing that, what we'll do is we'll just go through 3 questions. It should be fairly fast if you've got your slido.com opened. Okay, so here's the first question. This presentation, referring to the Ontario College of Pharmacists with Shenda and James, helped my understanding of how election reform can be accomplished within the framework of the RHPA, because we have that as our reality, and it's hard to change the RHPA, it's hard to change the Dentistry Act at this point. So if you watch the top right, we'll see the number of respondents, and we'll get it up hopefully just over 20, at about 15 now. And we will obviously capture the results. So right now, agree is at 61%, strongly agree at about 32. It's changing a bit, but over 90 still for agreement that the presentation helped your understanding. So we'll just give it 10 more seconds if you haven't had a chance to respond. So great, 21 responses, and thank you very much. We'll capture those results. Can we do the next question? My understanding has improved as to why RCDSO might approach electoral districts differently and why representation and diversity are beneficial to governance. So we're up around 16 responses, trending towards agreement, a little bit of strongly agree. Give it a few more seconds and allow us to get over 20. And Judy, do you?
Yes, I do actually. With respect to this question, I had some concerns about the things I heard this morning as well. So I just want to make it clear that when I say that my understanding has improved, and I agree with that, that doesn't mean I agree with what they did necessarily.
Yeah, no, fair comment, Judy. And obviously we're not doing anything at this point, but what it's doing is helping us to calibrate in areas where we can provide more information. And also, as we develop options that council will ultimately consider, there will be opportunity for anyone to agree or disagree and move forward in a way that works for RCDSO. So it's really meant to calibrate in terms of increased understanding, areas where you might need some more information or want some more information.
Okay, thank you.
Okay, so we'll turn to the next slide. I think we've captured 20. And this is the final question. I'm interested in learning more about options for changing RCDSO's electoral districts. So a few neutrals. A couple, I think, of strong disagreements. So we're at about 18. So 19, just about 64% in strongly agree and agree, 32% in neutral, 5% in strongly disagree. Hopefully we can get that up to 20 or 21. Give it 5 more seconds. Okay, thank you very much. Those are the questions. As I said, in response to Judy's question, there's lots of work still to do on this, but it's really important for council to see some of the experiences, not that you have to agree with everything that was done, but just to see that there are opportunities within the current legislation restraints and opportunities that we might want to explore as a council, and lots more to come on that particular issue that will be driven by the governance committee. Back to you, Hanno.
Thanks, Dan. And council, our final item before we break for lunch is a very timely matter for the college on the subject of COVID guidance. As you are aware, a number of public health authorities are signaling the end of the COVID emergency. Staff have helped to ensure that the profession is up to date on information related to the pandemic. The materials for this item are at pages 103 to 107 of your meeting package, and this is an item for discussion. And at this point in time, I'm going to turn it over to Cam Thompson, Manager of Standards and Strategy, to walk council through this note. So over to you, Cam.
Thanks so much, Hanno. I always feel a little uncomfortable being the last item before lunch, but I know this group is interested in this update. I think I can probably get through my comments in about 5 minutes. I'll set a timer just to make sure that I don't get carried away, but happy to take questions and comments afterwards. So as you've heard, I'm going to provide you with an update on the college's COVID-19 guidance document. I'm going to move relatively quickly through the content in the briefing note for those of you who are following along, partly so as not to be repetitive and partly because there have been more recent developments that are not reflected in your note that I want to be sure that I'm able to highlight and that I think will be of interest to council. And so by way of background, very briefly, I think you all are aware that our requirements for managing infection risks during the COVID-19 pandemic are captured primarily in our COVID-19 managing infection risks during in-person dental care guidance document. We do also have a COVID-specific teledentistry guide, and we have a fairly extensive COVID-19 FAQ that we rely on. But for most intents and purposes, our key COVID specific requirements and in particular, the mandatory infection prevention and control requirements are captured in this guidance document. And it's been in effect since early in the pandemic. It was developed originally by myself, along with Dr. Michael Gardner, who was our former director of quality, along with just a whole list of staff partners and subject matter experts that I really couldn't summarize very easily, but definitely sort of a collaborative effort. So the document's been in effect for about 3 years, and it's been updated multiple times, mainly in response to sort of key developments in the landscape, in particular changing public health requirements. But throughout those updates, our main aim has really stayed the same, which is to maintain as much as is possible a reasonable and evidence-based balance between precautions, which serve the public interest by promoting patient safety, while not sort of overreaching and unnecessarily inhibiting the provision of care or impeding dentist professional judgment. And so in developing these positions, and we know that our guidance has elicited different reactions over the years, but our decisions have always been guided by a variety of inputs. These have been described to council in the past. They include a careful review of literature. Expert consultation has been a big component, as has compliance with the relevant public health authorities. It's important as well, I think, to point out as part of background that we aligned our guidance with the other oral health colleges in 2021. So these colleges represent dental technologists, dental hygienists, and denturists. And since then, we've managed to keep our guidance in alignment with one another. The last update to our guidance was last summer. It was August, September 2022. And our main goal at that time, with the pandemic showing signs of improvement, was to pare the college's guidance back to what we felt was its bare essentials. And so you might recall at this point, we rescinded requirements for fallow time, along with sort of a significant number of other clinical and administrative details. And the guidance became much more narrowly focused on PPE requirements and the treatment of COVID positive patients. And so effectively, since last summer, our guidance has been pretty narrowly focused, but not without pain points. We've heard this loud and clear. We know that the PPE requirements in our current document in particular are proving challenging for dentists practically and are hard to sustain indefinitely. And that's just an example. We know there are other pain points as well, which more or less brings us to where the briefing note ends, which was sort of the point in time when it was submitted for the council materials. But since then, there have been some sort of important developments. So the briefing note basically ends with an acknowledgement of the changing circumstances and an assurance that analysis is going to get underway to support decisions about next steps for our guidance. And since then, we've effectively carried out an accelerated analysis, which I think is going to support decisions for next steps. And so I'll describe that work just in a little bit of detail. It was undertaken primarily by myself, but with staff partners. I want to in particular mention Dr. Brian Feldman, Dr. Mary Colaveras, and Dr. Helene Goldberg, who supported that work. I'll just speak briefly about the process just to try and reinforce the sort of rigor of the analysis. The main question we were trying to answer is whether or not our guidance was still sound in light of changes that have occurred since we last updated it, basically last summer. And so we looked at a number of inputs, as we always do. We looked at public health indicators. We looked at a cross-section of the guidance from other health regulatory colleges, and in particular, oral health regulators. We looked at a fresh literature review, and we looked at the updated guidance of the key public health authorities. And I could talk about sort of the research in a lot of detail, but I won't in the interest of time. I'll just highlight a couple of key observations, which I don't think will come as a surprise to this group. The first is that public health indicators are showing signs of continued improvement, with some caveats around sort of the quality of data that's available, but it paints overall, I think, a pretty consistent picture. We're seeing a decreasing incidence of severe outcomes for COVID infections, so looking at things like hospitalizations. Our literature review did not identify any new risks for dental settings that we hadn't already contemplated. Importantly, looking at other regulators and dental regulators in particular, a number, including the dental colleges in Alberta, Manitoba, and Quebec, have effectively rescinded their COVID-specific guidance and have reverted back to their standard IPAC. And a handful of the hygiene colleges have done so as well. These are fairly recent developments, and a number of colleges continue to have COVID-specific guidance in effect. So I would say, you know, in looking at our guidance at the present moment in time, we're not ahead of the pack, but I wouldn't say we're behind the pack either. I think a number of other colleges are contending with this issue right at the moment. And of course, we looked at what the updated guidance was of the key public health authorities, and we were looking at Public Health Ontario and the Ministry of Health in particular, because our priority has always been Ontario public health authorities. And I think the key piece that I want to emphasize more than any other is that if you look at our current COVID guidance, virtually all of the provisions that we set out, the recommendations and requirements, are simultaneously set out either in our own IPAC standard or in the applicable guidance from PHO or MOH effectively. So in other words, our assessment of the guidance that we have currently set out for COVID is that you could arguably simply direct members to our current IPAC standard and the applicable guidance of PHO and MOH, and still be confident that we were covering the sort of key bases that we wanted to cover. And so, not surprisingly, having said that, one of the considerations that we're exploring is rescission of our COVID-specific guidance, reverting back to our standard IPAC document, and as I said, sort of directing dentists to applicable public health guidance where it would be appropriate to do so. I'll also add, and I think Harinder touched on this, or maybe it was Dan in his comments, we've initiated discussions with the other oral health colleges to see what their reaction is to that analysis and to see whether they are prepared to have a conversation with us about options, including contemplation of rescission. Which really brings us up to the present moment in time. So I'm happy to take questions and comments. I'm also happy for Dan or others to jump in if there's any context that they want to add.
Thank you very much for that, Cam. And at this point in time, I am going to turn to you, Council, to see if there are any clarifying questions for either Cam or Dan. So Mark Eckler, you're first on my list.
Thank you very much, Hanno. Do you have a hard date of when you're going to come back with new revisions? It has been almost 10 months now. And as you mentioned, several other regulators have rescinded their COVID guidelines.
I don't know whether Dan might want to comment on that.
Sure.
Yeah,
sorry. Mark, it's been 10 months since we modified our guidance, but as Cam said, there have been some colleges that are just out of the gate in terms of rescission. So it's not 10 months behind those decisions. The hard date that we're exploring right now is to get something to the executive committee. As Cameron said, there was an accelerated effort to pull together all the information. It wasn't ready for a decision today, but we expect that we will be able to go to the executive committee on July 14th, I think it is, if not sooner. But those are the dates that we are looking at right now in terms of when we will be able to bring all of this forward in a package that the executive can make an informed decision in terms of next steps.
Thank you. Erin?
Yes, thank you for pulling together all of the information and going back to this issue. I strongly support going back to the pre-COVID guidance as soon as possible. I'm not going to bring up any of the pain points or any of the issues that I'm sure everybody is quite familiar with, but I think from the ICRC perspective, when we look at complaints and reports of people who are not following the guidelines, it's all based on risk. That's a key part of the puzzle in how we enforce the guidelines that we have in place. And so if we get a complaint that a dentist isn't following the enhanced protocols, I don't know how we can issue an outcome if we can't show anymore that there's risk that's being incurred by not doing something that's not backed up by evidence anymore at this current time, given the current conditions. So that's just my 2 cents on this. So I'm looking forward to having a proposal very, very soon that we can update and make sure everything is in line with current conditions and what's needed.
Thanks, Aaron. Anthony Mayer, you're next.
Thank you, Hanno. My question is really about sort of reframing this discussion away from the idea about public health outcomes, because I think they're somewhat irrelevant when it comes to this particular disease and dentistry. And so really what I'd like Cam to do is to because to the best of my knowledge, there's still either none or scant evidence of transmission of this disease at the dental chair. So I'm wondering if there's any new information with respect to that, because if there is no evidence of transmission of the disease at the dental chair, then what's happening out there in the public and the hospitals is somewhat irrelevant to our job here. Thank you.
Thanks, Anthony. Cam, did you want to respond to that?
Yeah, I can answer Anthony's question, which is an excellent one, which is to say, you're correct. There is no definitive evidence that we've been able to put our hands on that would demonstrate, an increased incidence of transmission occurring in dental practices. That's the really easy and quick answer. The more complicated answer is that I'm not sure how we would know if transmission was happening. The surveillance programs that would be theoretically looking at type of data have been significantly scaled back. And so I would simply say, I think that is a good rationale for taking a fresh look at our guidance. And I think at this stage of the pandemic, I think that's a strong rationale for moving away from COVID-specific precautions. But it continues to be an issue that an absence of evidence kind of cuts both ways. It makes it difficult to support continued requirements, but it also makes it difficult to justify rescinding precautions, if that makes sense.
Thanks.
Thanks, Cam. And I have 3 people still left on my speakers list. Jamie, you're next.
Personally,
Jamie, we're having trouble hearing you. Jamie, I don't know if you need to turn up your volume. Try that.
Okay.
It's kind of cutting in and out. So Jamie, how about I go to the next 2 speakers and then I'll come back to you at the end and see if it's any better. So Anthony Licio.
Yes, since we work very closely in dental offices, the relationship between hygiene and dentistry, what is the situation with the hygienist college? Because, it caused a lot of havoc when the fallow times were different between the 2 colleges, the requirements back a couple of years ago when this all started. So I'm just curious, because it would certainly make life a lot easier if both colleges agreed and then we could, easily move forward. Thank you very much.
Dan, would you like to answer that?
Yes, I can. And Anthony, it's been a priority, I would say, of mine, and I would say also of council's, to make sure that we don't have that confusion at the local level. And so the registrars of the colleges meet probably monthly, and we've done a lot of work to really build the relationship between the 4 colleges. And as Cam said earlier, we have really floated these concepts in terms of how we can move forward and how important it is to move forward together. Those discussions are ongoing. But I think it is, yes, it's important for us to address issues that are an imperative for the public and the profession of dentistry. But we also, at the same time, where we can prevent it, we do not want to create confusion at the local level. So there's a number of balls in the air, but I would still suggest that we're going to look at those timelines that I mentioned, and we're going to try to bring forward, a package of recommendations to the exec that will hopefully have the endorsement and movement with the other colleges as well, but still some work to do.
Thanks, Dan. And I've got Jamie, Noah, and Nalan on my speakers list. Jamie, I'm going to go back to you and see if we can hear your question now.
Can you hear me?
Yes, we can.
Okay, wonderful. The RCDSO is calling me now, so no need to call. All right, my view here is, perhaps it is time to return to the traditional IPAC protocols. And I think it's a little bit about education as well. I think that any changes from the COVID or backing off from the COVID protocols should be enhanced. It should be followed up by, educating the public, re-educating the dentists on the strength of the IPAC protocols. The public should be aware of that, better aware of that perhaps. But also we have to acknowledge that COVID is real, still here, and that we are taking the necessary precautions through the IPAC program.
Thanks, Jamie. Noah? I think you need to unmute, please, Noah.
There we go. Thank you, Anna. Thank you, Cam, for putting this work together. And I do want to just quickly confirm that the current studies, a couple of studies conducted in Canada and others from around the world, are suggesting that dentists / the dental clinic environment is not high risk for COVID-19. And while we completely acknowledge that the guidance was definitely needed and appropriate back then when we lacked knowledge on this from a precautionary prevention approach, now as we're transitioning to the evidence-informed practice, we do know that maintaining the IPAC standards as they currently are may no longer be necessary and actually may be negatively impacting access to care for the vulnerable populations that we serve. And I'll speak from a dental school perspective as well. We serve a very particular and vulnerable group of the population. The current standards are impacting dental education, and I would assume the same situation would be happening for other oral healthcare workers. The costs are just borne by educational institutions and the students, and not to mention the environmental impact that we're having. So again, I'm in support of your suggestions, Kim.
Thanks, Noah. Nalan?
Yeah, so thanks. So my question is for Cam. The question, is it doable? Is it feasible? Is it doable and feasible that you can have new recommendations to Executive Committee on July 14th, 2023?
Yes, I believe it is feasible, especially if the approach is a relatively straightforward one. If we're talking rescission to be accompanied with sort of an updated communication to the membership and perhaps some patient-facing resources, and if we have alignment with the other colleges on this, then I do believe it is reasonable.
Okay, thank you.
And last person on my list is Mark Eckler.
Just in brief, I just want to express my support for all previous speakers who I don't think the middle of July can come soon enough based upon evidence and hopefully rescinding the guidelines and going back to what we were before.
Thanks, Mark. Thank you as well, Cam, for your participation and your comments in your report. Thank you, council members, for your thoughtful questions and comments. At this point in time, I admit that we have gone through a significant agenda topics in the morning. We have a packed agenda for the afternoon as well. So it is currently 12:16. I'm going to suggest that we take a lunch break of 45 minutes so that we would reconvene at 1:01. A reminder, members of council, that during lunch, if you would just turn off your videos and your microphones and be ready to start at 1:01. And for those of you watching today's meeting on YouTube, we will be stopping the live stream for lunch, but we will be resuming the live stream just prior to 1:01. And again, council members, have a good lunch, and we'll see you back here at 1:01. I'll maybe give it one more minute before we begin. I think we have most people back. Welcome back, everyone. Thank you. Next up on the agenda is an update on the Governance Committee development, one of 6 strategic projects. As Dr. Sandhu noted in his opening remarks, this work is critical to ensure that Council remains current with best regulatory governance practice. This item is for decision. The materials for this item are at pages 108 to 119 of your meeting package. And at this point in time, I am going to turn it over to you, Harinder, to walk Council through the presentation.
Thank you, Hanno. Angelo, can I have the slides, please? Good afternoon, everyone. On behalf of the Executive Committee, I'm pleased to be before you today to present on proposed new governance committee competencies, composition, and selection process for the inaugural committee membership. I know you have read all the briefing notes, so I won't repeat everything in it, but will briefly summarize the issues and the Executive Committee's recommendation for you today. So issues in briefing note are competencies for members of the Governance Committee. We heard a lot this morning from Pharmacists College about the competencies, Governance Committee composition, process for selecting the inaugural Governance Committee membership, and also the reappointment of the Eligibility Review Committee. Next slide, please. So let's, the background, give you a little bit of background. We started with CPMF in 2020. Ministry of Health governance reform proposal was put forward in January 2022, and Council approved that Governance Council reform report in September 2022, and we are guided by the guiding principles of RCDSO. And in June 2022, Council disbanded our previous Governance Committee. Next slide, please. So other drivers for this impetus we're discussing today. There's governance review and modernization strategic project. We have one central committee for governance oversight we want to establish. As we have heard from many colleges already, today was Pharmacy College, that other colleges are doing the similar kind of reforms and bringing the governance committees forward. Next slide, please. So Executive Committee recommendation number 1 is that competencies for members of the Governance Committee should be approved. They are in Governance Committee set out in Appendix D. So that will be the first thing to approve. Next slide, please. Governance Committee competencies. We have been discussing, staff brought it forward and executive approved it to bring it to the council. These are the domains within those competencies, interpersonal and communication skills. And I think all of us, the council, at least professional members, have gone through this kind of review by the Election Review Committee. Listening and understanding, technical knowledge, integrity, ethics, values, personal commitment, community involvement and experience, decision-making, professional judgment, and collective competencies for the committee. And it is on page 117 of council package. Next slide, please. So Executive Committee recommendation number 2 is Governance Committee composition. We heard in the last meeting about the composition from a previous another college. And based on the environment scan, we are proposing that there should be 2 professional members of the council, 2 public members of the council, and at least 2 individuals external to the college with regulatory and governance expertise. Next slide, please. Governance committee composition, as I said, there's been environmental scan through the Ontario Health Regulatory Colleges that have governance committees reflect a range of composition. And there's Ontario College of Teachers, selection and nominating subcommittees composed of 3 public council members and 2 professional council members. We heard from them in the last council meeting. And then there are other colleges which have a blended composition, which integrates strengths and success of committees. Eligibility Review Committee, which looks at diversity of perspective, expertise, objectives. Council members' participation on the governance committee will enhance accountability to council. Mix of dentists and public members support the guiding principles that leadership is shared, and a blended representation supports a minimal conflict of interest in the selection process. And as we all, I think, agree that small committees are effective and efficient for decision making. So next slide, please. So executive committee recommendation number 3, selection of the inaugural governance committee membership. The eligibility review committee provides a recommendation regarding the inaugural governance committee and chair directed to the council. Next slide, please. What we are proposing will be beneficial to have an external group review and propose members to ensure impartiality. The ERC is familiar with the current competency-based assessment framework and has been trained by an external consultant on behavior interviewing. And I think they have done a good job at the last election cycle. So next slide, please. Recommendation number 4, reappointment of the eligibility review committee. And we are asking to reappoint 10 members from the 2022 election cycle to the eligibility review committee as listed in Appendix E. Their names are listed there, 10 people. Next slide, please. Next step says staff will recruit for the governance committee and bring a proposed governance committee slate to council for appointment in September. In September, council will also consider proposed bylaw revisions, operationalizing the governance committee. Amendments will also be proposed to clean up the bylaws by removing redundant committees that performed functions now assigned to the governance committee. Next slide, please. So if you have any questions, Dan, Dana, Alan, we are here to answer any questions you may have on composition, competencies, selection process, and the reappointment of the governance, the eligibility review committee.
Thank you very much, Surinder. I see Anthony has his hand up. Anthony?
Thank you, Hanno. I didn't hear any mention of this, but it would seem to me that it would be appropriate that whichever members are chosen for the governance committee should not be part of the executive. Just putting that out there for comment.
And you want to take it up because we have actually left that people can apply from executive committee, but any thoughts about it?
Yeah, I don't know if I have any particular thoughts, but I know the executive committee did consider this and wanted to leave it open for council members. So that would include those who sit or serve on the executive committee. I would possibly look to Alan if there are any conflicts, which I don't believe there would be, but it's really ultimately up to council to decide that. But it was left open, Anthony.
Thanks.
So I would say that there are no conflicts. You can establish a barrier so that people on the executive committee cannot be on the governance committee, but without that barrier, the decision is left to council. So if in council's wisdom, if they think someone should be on both, they'll do that. And if in council's wisdom, they don't think someone should be on both, they won't do that.
Thank you. Jamie Colliver.
Yeah, I think on that question, Alan, appreciate your comments, but perhaps we should ask somebody who is entirely skilled at governance, i.e. a consultant, come and tell council if it's appropriate or not, bylaws notwithstanding. Okay, the list of competencies, I saw a heading on technical training or technical skills. What technical skills would we be referring to, or is that list going to be expanded, or how do you define technical skills?
My impression, Jamie, is that technical skills relate to IT management and how you can log into these meetings and you can manage the material online. That's what my understanding, but I would like Dan to add anything if he wants to. Thank you.
All that I will add, and then I'll turn to Dana, is on page 117 of your materials are 5 bullet points that try to describe what is meant by technical knowledge. Dana, were you going to refer to that page, or do you have something else?
I was just going to refer to that page. Thank you.
Thank you.
Thank you.
Thank you. Any further questions? Seeing none at this point in time, we are going to address 4 motions. We are going to address them all separately. So I would ask that motion 3A be placed on the screen right now, please. And the first motion for council's consideration is that council approves the proposed competencies for the governance committee set out in Appendix D. Anthony Licio, are you moving this, or do you have a question? Okay, you need
I'm moving this.
Okay, moved by Anthony Licio, seconded by Ellie Fisher. Any questions specifically about this motion? Seeing none, all in favor, please use your raise hand function. Okay, I see everyone in favor with the exception of 1. So would you lower your hands? Oh, I think everyone was unanimously approved. Thank you very much. The second motion, if we could have motion 3B on the screen, please, is that council directs that the proposed bylaw amendment to establish the governance committee as a standing committee of the college include the following composition for that committee, namely 2 professional members of council, 2 public members of council, and at least 2 individuals external to the college with regulatory and governance expertise. And Osama, can I say that you are moving this motion?
That is correct.
Thank you. Seconded by Jamie Colliver. Any questions specific to this motion?
I have a question.
Okay, Anthony Mayer.
Thank you. I'm just wondering if this is the right place to put a codicil to this motion, that we explore Jamie's idea just to find out whether it's appropriate or not for people on this council to also be part of the executive.
Okay, thank you for that, Anthony. And I think I'm going to kick that over to you, Dan. And if you're not the right person.
Yeah, well, I think there's 2 distinct thoughts here. One is the motion that prescribes the composition that you still have to vote on. We will certainly look into this. I know that there has been some work to look at other colleges and their governance committees, and there are some that do have executive committee members on, i.e. the president and or vice president. So it's not that there is a potential rule, but we will certainly look into it to make sure that that is in fact the case. And if we find anything out, we will bring that back to council when you're in a position to appoint.
Thank you.
Could I just ask a question about that, please?
Yes, Judy.
I'm just wondering if Anthony or Jamie can articulate what the concern is. I don't see a real theoretical conflict either. So what is the concern that your question is really addressing?
So Jamie, would you like to respond to that first?
No, I was supporting the research into Anthony's question. So I'm ambivalent on this particular point, but if Anthony wishes to propose this as a question, then we should have the appropriate person address that with, in terms of committee compositions.
Okay, thank you.
Sorry, I would say I'm equally ambivalent and ignorant on this subject, but it just seemed to me that it might be something we want to clear up. But I have no expert knowledge on this subject whatsoever.
Okay, thank you. So Dan, if I understand you correctly, what we are going to do now, we are going to move forward with the wording of this question, which in essence is about the composition of the committee. Should council wish to pursue the idea of members of this committee not being members of the executive, that is something that can come forward down the road. Is that correct?
Yes, they are in many ways mutually exclusive. You can prescribe the composition, and then the actual appointment of members is a different decision down the road.
Okay, thank you for that clarification. So that motion still stands. I believe it was Usama who moved it, and I believe Jamie Colliver who seconded it. So now what I will ask is to use your raise hand function for all those in favor of that motion. Please indicate so now. And that motion to me looks like it's also carried unanimously. Thank you very much. Next up for council's consideration is motion 3C. That council directs the Eligibility Review Committee to bring forward to council recommendations regarding the inaugural governance committee members and chair. So again, I would ask, that is moved by Amelia, seconded by Vivian. Any questions about this specific motion? Ellie, did you have a question or not? Okay, in that case, all those in favor, please indicate by using your raised hand function. Okay, and that is also unanimously carried. Thank you. And the fourth and final motion for this is motion 3D, that council approves the reappointment of all 10 members from the last election cycle to the Eligibility Review Committee as listed in Appendix E. And if I could have, that is moved by Jamie, seconded by Ram. Any questions? Mark, Trudell, and Judy, do you have questions, or are you just getting ready to vote?
Just voting early.
Okay.
And often.
In that case, those in favor, please indicate so by using the raised hand function. And that motion is also carried unanimously. Thank you very much. The next item on our agenda is a feature of our council meetings, and it's a program update presentation. This presentation is part of ongoing college updates designed to enhance council understanding of strategic project work. This item is for council's decision. Oh, sorry, Mike, excuse me. This item is for council's discussion. I'll turn things over to Cam Thompson, Manager of Standards and Strategy, to provide council with a briefing on standards work. And Cam, once again, over to you, please.
Thanks so much, Hanno, and appreciate another opportunity to speak to you today. I'm just going to share my screen really quickly. Can someone confirm that they're able to see the deck?
No, we cannot yet.
Okay, bear with me 1 second. I take it, Hanno, you're still seeing my face, right?
Yes, I will let you know when I see a deck.
Okay, thank you so much.
Okay, Cam, okay, yes, we can see it now, Cam.
Are you seeing it with the notes also?
Now I'm seeing, I think, your cover page, council update, RCDSO policy team, and standards modernization.
Perfect. It's tricky when you're seeing something slightly different than what I'm seeing, but it sounds like you're seeing the deck, which is what I was aiming for. So thank you so much for confirming. So as I said, I'm happy to be back to talk to you a little bit more this afternoon and to pick up on some questions actually and comments that came out of this morning's discussion. I can hopefully provide some elaboration and some detail about our standards work. As a quick matter of housekeeping, it's difficult for me to see everyone when I'm sharing a slide deck. And so I'd suggest that we hold questions until the end. I think my sort of presentation will probably be about 10 or 15 minutes perhaps. And I'm happy to take some comments when we get to the end, if that's okay with everyone. And so this is going to be a relatively brief presentation, but I think it's always helpful to start with an agenda. My objective is to introduce you to the policy team. You've been hearing a lot about us, but we haven't had an opportunity to work with many of you, and to familiarize you with the work that's been underway to update and modernize the college's approach to standards work, which is something we've been touching on this morning in a number of different ways. And as part of this, I'll provide just a quick snapshot of our larger review and development framework so that you know what the process looks like from beginning to end. And I'll place some extra emphasis on the important role that council is going to play in supporting this work. And lastly, I'll provide just a sense of our upcoming work and our key priorities. And so you now all know me. My name is Cameron. I'm the manager of standards and strategy here at the college. I've been with the college for 3 years. I've been in the manager role since September. Jean Hopkins is our policy analyst. She joined us in 2022, and she's somewhere out in the ether. And Michelle Cabrero-Gali is our newest team member. She joined us as a senior policy analyst in January. And so really briefly, what is our role? So this is really only a partial snapshot of our current workload, but it probably goes without saying our main area of focus is standards review and development. And this includes responsibility for all of the college's standards, guidelines, and practice advisories, which set out, as you know, expectations for professional and ethical conduct of our members. We also provide a key facilitation role for the college's annual CPMF report, which you've heard about quite a bit. And we have a key role in supporting the development and implementation of the college's strategic plan, which you've heard a lot about this morning. We supported the development of the new strategic plan. We provide project management support to the college's strategic project managers. And we also have ownership of 3 strategic projects of our own within the team. And those projects are college standards, access to care, and practice models in corporate dentistry. But this is really sort of the tip of a bigger iceberg. We have a number of additional support functions that you really couldn't capture in a single slide. As you heard this morning, we have a role in supporting the college's COVID-19 guidance and our response to the pandemic. We provide analysis on new and emerging issues. We provide GR and legislative monitoring support, and we provide committee support as needed, in particular to PRC. And so, as I said, key area of focus and responsibility for the team is the college's professional and ethical expectations, which are captured and communicated mostly in standards of practice guidelines and practice advisories. At the present moment, we have 25 core documents posted on our website, but we also have sort of a small catalog of additional resources, some of which include types of guidance, including multiple COVID-specific documents that don't fit exactly into these 3 buckets, and lots of supplementary content like FAQs, checklists, and articles. And one of the challenges we've had to face as a new policy team is to form a complete picture of all these additional types of documents and to ensure we know what we have on the books effectively. And I want to talk briefly about our approach to what we've been calling standards modernization, because this is a sort of a whole framework of process changes and improvements that we've been implementing at the front end that are going to enable us to do the bulk of the standards work that needs to be done. And so historically, standards work at the college has been undertaken by staff in the quality department. As I think I mentioned, until 2020, we didn't have a dedicated policy staff. I understand that sort of this approach started to change sort of in a concerted way in 2019 with initiatives that were kicked off by Andrea Fodi, our Deputy Registrar, Mike Gardner, our former Director of Quality. And I think there were several drivers for this reevaluation of the way we did standards work. And I'll summarize a few, which I think can really be roughly categorized into sort of two big buckets. And the first set of drivers are at the systems level, and they include basically sort of evolving best practices for policy development and changing stakeholder expectations that would apply to health regulators more broadly. And this really, I think, reflects recognition on the part of regulators and subject matter experts that the usual process for developing regulatory policies, which tended to be internal and a little bit opaque and technical, that it needed to evolve. And a lot of these key best practices were articulated in what's become a well-known report in 2018 by Harry Caton, who's a regulatory expert and who was commissioned to comment on regulatory issues that were occurring in BC. And over this same period of time, we've also seen necessary and system-wide sort of focus on equity, diversity, and inclusion, which led, I think, regulators more broadly to recognize ways in which sort of key groups, in particular patient groups, were underrepresented in the work that we were doing. And these are groups that are traditionally underserved as well. And so it was important to start thinking more critically about sort of inclusivity strategies. And as you've heard many times before, there's also the ministry CPMF, which includes specific measures related to standards and which are intended to drive process change. And so we needed to be responsive to what was in CPMF. At an organizational level, these are some of the issues that we're focused on. I think there's a general recognition that there are issues in some of our existing resources that require consideration and in some cases remediation. This is something we've heard from staff. It's something we've heard from council and committee members. We've heard it from members and practicing dentists as well. And so we've heard, for instance, that some of our standards are out of date. We've heard that they can be long and technical and difficult to read. And we've heard as well that they could be a little bit inaccessible if you consider a broader audience for our standards than just members. If you think about members of the public and patients, they're having, I imagine, a very difficult time sort of making heads or tails of some of our standards. And so this goal provides sort of a snapshot of what we're trying to achieve with our updated standards. So all the front end work that we're doing is intended to produce this result, which are standards that are up to date, that are evidence informed, that are accurate, that are accessible. And as I said, not just to our members or to practicing dentists and subject matter experts, but we want them to be accessible to patients and members of the public as well. We want them to be concise as much as possible. We want them to be inclusive, which is to say that we're considering and engaging with and reflecting a diversity of perspectives and experiences in our standards work. And of course, we want them to be aligned with CPMF. And this probably is not like a definitive list of sort of what we're aiming for, but these are some of the key pieces. And I'm hoping that you might recognize some of these goals or some of these objectives from the draft virtual care standard that we'll be looking at later this afternoon, because it's a reflection of the approach that we're trying to take in updating our approach to standards work. And so to achieve that goal, as I said, there are process improvements that we need to put in place on the front end. And this table provides sort of a list of some key examples. And in many cases, these process changes were presented to and received approval from either the Quality Assurance Committee or Council. Where that was the case, I've tried to highlight it just as a bit of a reminder. I won't go through them all in detail, but you'll see familiar things, right? So like an increased emphasis on robust and transparent external consultation. We've, as you know, narrowed the types of documents that we produce to just standards and resources. There's going to be a more consistent use of terminology to sort of delineate mandatory provisions from those that are permissive effectively. More use of plain language and updates that we'll make to our website to reflect some of these changes as well. And some of those updates actually are already in effect, and you'll see them if you visit our standards page. And I guess it should be emphasized, like the processes can be put in place and the work is underway, but in terms of how quickly you're going to see this reflected in updated standards, that's a process that will roll out a little bit more slowly because each document needs to be updated independently, and it can be a longer process. So having set out the work that's underway, we have a clear vision of where we want to go, but we do have some key challenges that we're facing. The two big ones I would think are highlighted here. We do hope that these are time limited in a sense. The first is team capacity. So to review all existing resources and emerging issues is an enormous undertaking. It's something that we're working on and developing strategies to address, but it is an issue. The other touches on an issue that Osama raised earlier, which is how do we prioritize work when there's a lot to do and everything seems urgent? And I'll be talking more about this a little bit later on in this presentation, but we've done a lot of background work to try and explore this question. And part of the solution that we've put forward is a decision support tool, which you don't have to read this. We're going to talk about it in more detail, and it's in your materials if you'd like to look at it. So you might be wondering how this all adds up to a regular review. So this slide provides a very high-level sketch of our approach. I'm going to move through it pretty quickly, but as I said, this is really just sort of scratching the surface in some sense. This is an approach that we apply to all standards and resources that are being reviewed or updated. It begins, as you can imagine, with research and analysis. There's sort of an optional preliminary consultation. So this would be a situation where we have an existing document that we want to update. And before we propose any changes to it, we would send it out for external consultation to ask stakeholders what they think about the existing document, what works, what doesn't work, getting sort of a practical perspective from those who use the document sort of every day in their practice. Of course, following a consultation, we would review feedback. We'd draft a new version of the document, basically. And that would be sort of our first touch point with the sort of key decision-making bodies. So those are the Quality Assurance Committee and Council. When a document's ready for external consultation, we would seek approval first from Quality Assurance Committee, feedback and approval. So we want to know what they say. We want to know how they feel about the draft. We would consider and incorporate the feedback that they provide. But ultimately, we would be asking them for approval to bring a draft to Council for consideration for external consultation. Of course, the draft would then come to Council for, again, feedback and consideration for external consultation. Following that consultation period, you'd have a period of further drafting and review. And you basically go through that same approvals process a second time with the final document. So it would go to QAC for consideration and feedback and approval to submit to Council, and then to Council for final approval. This is a process that we've sort of developed with QAC. They provided feedback and approval for this process. And so this is the approach that we'll be taking to standards work going forward. And this is the approach that's produced the virtual care draft that you'll see this afternoon. And this is like a basic framework upon which we can lay additional layers, basically. So, we might strike a working group. There's other forms of additional engagement that we could add to the process, like public polling. And I think it's also worth emphasizing that based on experience, that the sort of timeline for this type of work, sort of beginning to end from like the very first research phase all the way to final approval, typically is within the 18 to 24 month range. Of course, our objective is to move as quickly as possible, but the process, as I've been saying, needs to be comprehensive and rigorous. And this is basically the way it works out. I do want to pause briefly just to reinforce a few of the key roles that I covered in my last comment. So first, as noted, all policy work will move forward with a policy analyst as the lead. Of course, we don't work alone or in isolation. We have to work with staff partners and with dedicated clinical support. So that will be the typical approach going forward, but it would be a policy staff member who would be stewarding the work and project managing the work through the process. As I said, all standards work is going to be supported by a staff clinical lead. We're going to strike working groups sort of as needed. Working groups have huge utility, and so that's something we think a lot about. And as I've described, QAC will have a role in reviewing and approving all this content, and Council will also have a role, sort of the ultimate role, in reviewing and approving content as well. So looking ahead, just to sort of wrap things up, there's still work to be done around prioritization, and we'll talk a little bit more about that after this presentation. And there's still some work to map out a specific course for updating the next batch of standards and resources, but 3 documents are under review, and I wanted to flag these for Council's information. So the first, as you've heard, is the COVID-19 guidance document, which we're looking at. The second is the virtual care draft standard, which Michelle Cabrera-Gali will present a little bit later on this afternoon. And work is underway to look at the informed consent practice advisory. So those 3 drafts are in under review. And at the risk of belaboring this point, again, we're thinking about prioritization, and the work to prioritize the next round of standards work is underway. After this presentation, I'll talk about the prioritization tool, which is in your materials, and I'll highlight it for you. And lastly, and this is a relatively recent development, Harinder mentioned this in his introductory comments, but at the direction of SLT, with Harinder's support and with the approval of the Finance Audit and Risk Committee, we are initiating recruitment for 3 contract policy analysts. The contracts are for 30 months. With the sole purpose of injecting support for the prioritization and standards work that I've been describing. So the objective is to have them help us undertake the front-end analysis, which would involve reviewing existing resources to sort of make sense of what needs to move forward on a priority basis, and then to take the lead on reviewing and updating specific standards and resources. And the 30-month time period was selected because that's a time period that would permit them to sort of complete that review from beginning to end. And we were challenged by FAR, and we've been challenged by our own HR staff to sort of contemplate other solutions to this particular problem. But in our view, this really seems to be the best workable solution for addressing the issue, which, as I said, is a backlog of work that it's going to be impossible for us to address without sort of additional support. And so that brings me to the end of the deck. I'll stop sharing and I'll pass things back to Hanno. But as I said, following some comments and questions, I'll also quickly take council through the decision support tool.
Thank you very much for that, Cam. Osama, I see your hand is up already, please.
This was really good, Cam. I like this one a lot. I had one question. Because I'm looking forward to the prioritization tool next, but is there a way where the new CE portal can tie into, so the way I think of it, it's kind of like there's like a 3-pronged approach to this, right? There's the CE portal, there's the quality assurance piece, and then there are the guidelines. Are we making sure that these 3 components are talking to each other? Because the guidelines are there and they're hard to search for. Like if you type in keywords at this point right now, you know, if you type in, let's say, sleep apnea, you won't get any good information on that. So I understand there's a lot of work to do, and the contractor idea is definitely, well, there's a lot of work to do there. But is there a role potentially at this stage to include this in relation to what the CE portal does? And so are you meeting the requirements, and can we emphasize that with regards to the guidelines? Or do dentists know that they're actually meeting the guidelines by doing the proper CE?
It's a great question, and the answer is yes. So that work is underway. There wasn't time to get into that level of detail in the presentation, but I would say staff are really leaving no stone unturned in terms of thinking about the intersection between standards with other sort of regulatory functions, and thinking about mechanisms that we could be leveraging to communicate more effectively about standards work, basically. And so yes, it's a really good question. That is something absolutely that we're doing.
Thank you. So Cam, you must have answered most people's questions or concerns, because, okay, Mark Trudell is putting his hand up.
Thanks, Mano. Cam, thanks again. Quick question. At the front end of your presentation, you referenced that you were had already vetted and were continuously seeking public input from the public with regards to the revised standards. Can you elaborate a little bit more on the mechanics, how you execute that, and how you satisfy yourself, or how the college satisfies itself that it's had sufficient input from the public? Thank you.
Yeah, I'm so sorry, Mark. It was probably my connection, but I didn't hear part of your question. So I'll just throw it back, and you can tell me if I heard it correctly. Was the question about how we have assured ourselves that we've sort of solicited the feedback that we need to hear to know what standards need to be updated and which ones are lower on the priority list?
Correct. And what are the mechanics? How do you carry that out?
So it's a hard question to answer, and there's sort of a cost benefit consideration, I guess, whenever you're sort of soliciting input. So we've undertaken some steps internally. We've connected with basically all of the major regulatory areas around the college to solicit staff feedback along the lines of like, which standards are you using in practice? How are they holding up? Where are you running into issues? We have data from PAS around inquiries that come in. We even have some data from very high level de-identified type information from PLP about the types of reportable incidents that come in, all sorts of information that we can put our hands on that paint a picture of where dentists might be tripping up and where our standards might be in need of sort of a fresh look or analysis. A lot of this, I think, is embedded in the prioritization tool, which I could talk about in a minute. But it's a difficult question to answer. We feel that we've struck the right balance in terms of soliciting information to inform this analysis, but there will be ultimately a degree of judgment that needs to be exercised. And at the end of the day, and this goes to the issue of recruitment. I mean, each document really needs a fairly careful and nuanced analysis that will necessitate that an analyst sit down, read it beginning to end, evaluate it line by line. And in those instances, there may be some additional specific steps that we need to take that are sort of document specific to make sure we understand the issues.
Thank you for that, Cam. Just in the spirit of brainstorming, putting it out there to the public at large that this process is in play and making use of our communications team, at least putting it out there in the public domain and ensuring that there's a level of awareness, maybe taking the opportunity to solicit any input concurrent with all the positive things you shared with us that you're doing internally. It's that external piece that I'm focused on, but thank you for that response.
Thanks,
absolutely.
Mark. And next up, Erin.
Yes, thank you for the update. It's really neat to see under the hood of all of these processes that are going on and constantly being upgraded. I was wondering if there's been any discussion when it comes to the composition of people that will be hired. Why we're leaning towards policy analysts versus researchers. It seems that a lot of what goes into developing these standards and guidelines is very research-based, and especially when we're dealing with potentially new policy and guideline documents that may come out with emerging areas like PRF or use of lasers or anything that's really cutting edge science that may pop up in the future. I know in the dental school, at least when I was there was a clinician researcher program which specifically trained people in these research skills, and I think they got a master's degree along the way. But there's a lot involved in literature review, being able to critically analyze what's coming out, what's being published, what's missing, what's not there. And I don't know if a policist necessarily has that scientific background to be able to dig really deep into that realm. Whereas somebody who's got the research background can do that, plus they can expand the search a little bit to see, maybe it's something as simple as what are other people doing? What do other organizations say about this? So I was wondering if it would be worth considering maybe going for people with research backgrounds. And I think the other thing with that, people who have that research, who've been through that rigorous academic research program, I know a lot of courses, like you have to bash out a 30-page paper in 6 weeks. So there might be the potential to truncate that timeline a little bit instead of having a policy analyst who spends 6 months doing whatever they do. You can have a benchtop researcher who can at least get a preliminary document maybe a little bit quicker because of their background.
Thanks, Erin. Cam, did you want to respond to that?
Yeah, I mean, it's a good question and it's an important consideration. I would make just a couple of points. I mean, the first is we're hiring for policy analysts, so the position is titled policy analyst, and that's what we're hiring for. But I would say we're open to candidates with all different backgrounds, and so a candidate with a predominantly sort of research-oriented background wouldn't necessarily be a bad fit as a policy analyst. I see Andrea's hand is raised, so I'll invite her to jump in a second as well. I would also say though, and I mean, I say this as a policy analyst, I think that there is a broad set of skills that are important to policy work that go beyond research. I mean, policy analysts with formal training in policy typically have a strong foundation in research and statistical analysis and those sorts of details that you would want to have. We also supplement our gaps in knowledge with experts. But one of the key skill sets of a policy analyst, it's the drafting side and it's the communication side. The drafting of the documents, the management of the consultations, all of those additional components of the standards review and development process are really essential. And those are areas where policy analysts tend to be uniquely strong. But I see Andrea's hands raised, so I'll give her a chance to jump in.
Andrea?
Yeah, thank you. And thank you, Kim. I just wanted to build on something Kim started to touch on, which is to say that typically, Aaron, the policy analysts that do a great job and we are targeting do have pretty extensive backgrounds in research and often have at least 2, if not 3 degrees of various types. Now, some do have a scientific background. Some do have backgrounds in other areas that have involved exactly the types of skills you're talking about, doing jurisdictional scans, doing literature reviews, doing papers, critical assessment, research of different types, as well as what Cam said in terms of statistical analysis. So I would say that there's a really diverse range of individuals who apply and are successful in policy work, who have a real breadth of talent and background that they can bring to the table, which helps us not just with the research piece, which is obviously critical, but with all the elements that is required to do this work well. So I think, as Cam said, we're in the process of building out job descriptions that are really going to capture those key core competencies. It's open to anyone who has those competencies to apply, including those who've done research programs that you've talked about. But I did want to just mention, we do typically have candidates that have a very, very strong research background.
Thank you for that, Andrea. And last person on my speakers list is you, Osama.
I just want to add to it that I actually agree with Cam on this one. And the reason is, Aaron, that and this is a great discussion, is that I see the policy analysts as more of the liaison, and they'll be able to utilize the experts. The research, you can go on and do research forever, and you can find and explore all these. But I think the biggest part of this is utilizing the resources available to you. So, and that's the strength of this role is to be able to reach out to the experts and really gain information. And again, I use the example of sleep apnea because it's it's going to become more and more of the forefront. But and there's a lot of practitioners now that are doing more sleep apnea related stuff. But I think the policy analyst will be able to reach out to a group of experts and get a very wide range of techniques and strategies, and then bring that to the table in the workshops and the working groups that they utilize. So I actually like the idea more of the policy analyst as opposed to the research analyst, but I think that it actually probably will get done faster if you have him as the point of liaison for this. But that's my humble opinion.
Thanks, Dan.
I just want to pick up on the reality is that, and this is for all of council, not just Aaron, who I know asked the question, you will see the product of this work, and you will see it very quickly over the next 2.5, 3 years, where you will look at multiple new or refreshed standards, and we will evaluate if the actual approach and the skill set and the consultations are working. And so I think to the question, you'll be able to tell us whether there was appropriate research that was involved in leading to the outcomes of those products. So lots of opportunity for you to tell us if it's working or not from a standard perspective. And I think, we'll continue to work to build this for council and for the profession and the public. But you'll have opportunities to weigh in on whether it's hitting the mark or not.
Thank you. Noha?
Great, thank you. So yeah, just wanted to, someone who have done dentistry to research to policy analysis and back, I think a policy analyst would bring in the research skills that are required. They would have, the analysis skills quantitatively and qualitatively. So yeah, so they'd definitely be doing the research with a focused lens, I would say. So yeah.
Thank you. And last speaker, Harinder.
Thank you, Hanno. And thank you, Cam, for very detailed and impressive presentation. I just want to make a comment that during the discussion on these issues, I have also asked Cam that his team built in the processes that these standards are always evaluated on an ongoing basis rather than leave it for 10 years and then come back and say, oh, we need to do it all over again. So I think there'll be inbuilt processes where staff will continue to evaluate and analyze and add or delete things which become redundant or are new. So I think it's a very good process we are undertaking. And thank you for everybody's support and the questions you have raised, issues you have raised. Thank you.
Thank you all. Cam, I'm going to turn it back over to you in a moment for the next and related item. The policy team has developed a decision support tool that will help to prioritize the order in which future standards, guidelines, and practice advisories are reviewed and updated. The materials for this item are at pages 120 to 125 of your meeting package, and this is an item for discussion. And Cam, it's back to you.
Thanks so much, Hanno, and thanks everyone for the great discussion on the last item. I have my stopwatch going, and I see that I'm already a little bit over time, I think. And so what I would propose is I'll move more quickly than I was planning to through my speaking notes so that we have more time for discussion. This is a sort of a verbal update. There's no deck to go with it. The only piece of material you really need to be looking at is the prioritization tool itself. It's in your materials at page 124. So I'd suggest that maybe that's the easiest way for people to follow along. I'm happy to share my screen if that's council's preference, but maybe for the time being, look to your council materials. You've heard a bit about this tool. You heard about it this morning. You heard about it in my presentation. There's a briefing note in your materials that sort of lays out the background for the tool fairly clearly. So I'll kind of just focus in on the tool itself and highlight some key points so I can hear everyone's reactions. So as you heard, we're intending to use it as a means of evaluating standards and emerging issues, so it really applies to either category, using a standardized scoring rubric. What we wanted was a systematic and transparent, and to the extent we could make one like a quantitative approach to evaluating standards that would produce a result that would allow us to stratify documents and stratify issues based on specific criteria. And so we identified 10 criteria. That's a product of discussion within the policy team. It was informed by discussions with Dan and Andrea and other college staff. We also brought this to the Quality Assurance Committee, where we had a very fulsome discussion. They provided specific feedback, which produced revisions, and they've ultimately approved the draft, which is here for council's discussion. I won't go through every metric. I was planning to, but I think in the interest of time, I won't. I'll just highlight sort of maybe one key consideration just to make sure that it's top of everyone's mind, which is that sort of based on the Quality Assurance Committee's feedback and given its sort of central importance to any consideration of prioritization, the question of patient risk has been somewhat set aside. It's been made the very first criteria at the top of the tool, and it's also subject to a slightly different scoring approach. So patient risk some risk or significant risk is weighted much more heavily than the other criteria in the tool. And this again is meant to sort of signify or reflect the fact that this is a very high priority. So any standard issue that arises that has significant patient risks associated with it is going to find itself very high on our list of priorities, basically. I'll just highlight a few key considerations to make sure that they sort of are pulled out of the briefing note. The first is that, we've validated this document or this tool to the extent that we're able with our capacity by sort of applying it to some different documents. But we are alive to the reality that as we run more and more documents through it and more issues through it, we may see needs to make modifications. There might be missing metrics that we want to add, or maybe we need to make some additional adjustments to the scoring. So we are thinking about it to a certain degree as a bit of a living document. But we feel that it's in a fairly definitive shape, and we've committed to the Quality Assurance Committee that if we were to propose any significant changes to the tool, we would bring it to them for additional discussion. And I think I would leave it at that. The tool, as I said, I'm happy to share my screen if that would be council's preference, but I'm sure that there are comments and questions in the group, and so happy to hear people's thoughts.
Thanks, Cam. First hand up is Anthony Mears.
Thank you, Hanno. Cam, very impressive tool. My question is really just about the differential weighting of question 1 versus all the other questions. And I agree that there should be significant more weighting for patient health or injury questions. So my question is really just, how did you arrive at that weighting? Is there some kind of industry standard that was applied?
Oh, sorry, Anthony, but it's a great question. No, so as far as an industry standard is concerned, we were not able to find a specific tool to use as a basis to develop our own. So we really developed this ourselves. In terms of where that weighting came from, it's a bit of it was more like of a logical decision than a mathematical decision. I think the intent there was that if the first criteria produced a score of 20, that was effectively equivalent to the cumulative score of all the subsequent measures added up. That was sort of it wasn't arbitrary. It was like the product of discussion effectively, but it was hard to know where to draw the line, like how heavily weighted is too heavily weighted, how heavily weighted is not heavily weighted enough. And I think that in some sense goes back to the point I made a moment ago about the need to treat this as a bit of a work in progress. I think that the extent to which this produces the result we want, which is to say a result that gives us a meaningful and legitimate distinction between documents, I think we're going to see that when we put it in practice, and it's going to take time. And as I've said, we might even need additional capacity on the team to really start applying this to a large number of documents.
So thank you. Just a short follow-up. Have you hypothetically tested it to see how it performs?
Yeah, we have run some documents through it, and it seems to produce the result that we would want it to. Like I said, not preconceived notions about which documents are the most important, but it's giving us like a reliable and seemingly rational sense of which documents are maybe higher priority than others. But so far it seems to work. That's the version that we're working with. But if we find that changes, we'll figure it out.
Thank you, Osama.
Sorry, guys, I have a lot of comments on this stuff because I really like this stuff. So Cam, have you thought of, and hopefully explain this properly, have you thought of grouping specific guidance documents that can be, so, when you're making them, like you can add another category to this, like can the guidance document be done quickly? Right, the speed of the document is also important, right? And because cumulatively, let's say 10 documents can be done, or 10 standards can be done very, very fast, but collectively those standards are useful as opposed to just doing one, which is also very important too. And is there consideration in grouping guidelines in this setting? Hopefully I've explained that properly. Hopefully you get what I'm saying.
No, I do. And I think that I am positive that in an earlier iteration of this draft, we had a specific measure related to whether it was a complex or a less complex review. If memory serves, I think we got some feedback from this at the Quality Assurance Committee meeting, and the members of the Quality Assurance Committee didn't feel that it was that consideration rose to the level that warranted inclusion in the prioritization tool. I would say, though, there are some metrics in here that kind of might touch on that. For instance, number 9, are there strategic reasons to prioritize a standard resource or issue? So that, one could interpret that metric as including a consideration of a variable like the one you're describing, whether it's complex, whether it's not complex, whether we have work that's already been completed that's going to make the review that much easier to complete. But you explained it clearly. It's a really good suggestion. We had considered it in an earlier iteration of the draft. The idea of batching the documents, though, potentially is one that I hadn't considered, and I think that that's something that we could take away.
Thank you very much for that. Cam, I'm seeing no other questions, so I would like to thank you very much for your very informative presentation to Council, and Council for the questions and the feedback that you have provided. We look forward to hearing from you again, Cam, at the appropriate time. And what I would like to...
Thank you so much.
Thank you, Cam. I would like to suggest we move on to the next item on the agenda, which is the draft standard on virtual care, also known as teledentistry, and it's been developed by a working group. The material in your package regarding this item can be found on pages 126 to 147. Council is being asked whether it has any feedback on the draft and whether it approves that the draft standard of practice virtual care to be released for external consultation. This is a decision. We will require a decision from you, rather. Nancy DeSanto, Chair of the Quality Assurance Committee, has a presentation based on the briefing note for Council's consideration. And Nancy, I'm going to turn it over to you now, please.
Thank you, Hanno, and good afternoon. I'm pleased to present the draft virtual care standard on behalf of the working group who developed it. This draft standard has a significant history, which I will briefly go over for context. Then we will turn to the draft documents that have been developed, and I will pinpoint where we are in the standards development process, and will highlight the key features of the draft standard and FAQs. Finally, we will have time at the end for questions and discussion. In 2019, Council struck a teledentistry working group to develop a draft teledentistry standard. The working group's work on the draft teledentistry standard helped inform the development of the RCDSO's COVID teledentistry guidance. Work on the draft teledentistry standard was paused when Dr. Michael Gardner retired in 2022. In 2023, the working group was reconvened with Dr. Sandy Venditti continuing in her role as chair. The working group converted its initial draft teledentistry standard into a more modern virtual care standard. As you heard in Cam's presentation earlier today, one of the improvements that has been implemented is the standards review and development process. I won't go over this process in great detail, but we'll use it to situate where the draft virtual care standard is in the development process. The initial work on developing the draft standard has been completed, and it is now before you for the first time. You are being asked whether it can be released for external consultation. If approved, the consultation will be held for 60 days, and the feedback we receive will be used to further refine the draft before it returns to Council for final approval later this year. As we are finalizing the content, we will consider how best to communicate the expectations and guidance so it can be easily understood and operationalized. This may include additional FAQs, visuals, and tools such as checklists. Now, turning to the draft documents, the draft standard sets out requirements for Ontario dentists who provide virtual care to patients. That is, interactions between dentists and patients. The draft standard does not set out how new expectations for consultations between healthcare providers or referrals, because obligations for consultations and referrals are already set out in 2 existing college resources. Accordingly, these resources are referenced in the draft virtual care standard, and question 13 in the FAQs provides additional information. It is important to note that the draft standard is limited to Ontario dentists, that is, members of the RCDSO. The working group decided to limit the scope of the standard to Ontario dentists, given that the RCDSO does not have the legal authority and to require and enforce licensure for out-of-province dentists who provide virtual care to patients who are geographically located in Ontario. This position is consistent with the external legal advice we received and the position taken by the College of Occupational Therapists of Ontario. The working group thought it was important to provide guidance to patients in the FAQs regarding the implications of receiving virtual care from dentists who are not regulated in Ontario, and this is set out in question 12. The draft sets out requirements that Ontario dentists must adhere to when assessing the appropriateness for virtual care, providing virtual care, and providing virtual care across borders. The working group felt it was important to set out what the appropriate use of virtual care looks like to help ensure that Ontario dentists are only using it in these circumstances. The draft standard specifies that virtual care is only appropriate in circumstances where, number 1, Ontario dentists can meet the standard of care and all applicable obligations. Number 2, Ontario dentists have the required resources and can use them appropriately. Number 3, the dental care can be effectively delivered virtually. And lastly, number 4, it is in the patient's best interest. The draft standard sets out the following requirements for Ontario dentists when providing virtual care. In the interest of time, I won't read them all out, but will highlight the first 2. The working group thought it is especially important in the virtual context for the patient and dentist to identify themselves and where they are geographically located, to help Ontario dentists identify whether any cross-border care is occurring. The working group also felt that it was important for Ontario dentists to obtain the patient's consent for the use of a virtual modality and wanted to emphasize that this consent requirement is one imposed by the RCDSO and separate from the consent to treatment requirements set out in the Healthcare Consent Act. The last section of the draft standard sets out requirements for Ontario dentists when they are not geographically located in Ontario and when patients are not geographically located in Ontario when virtual care is delivered. Given the complexities in the provision of cross-border care, the working group included a number of FAQs on this topic to provide further information and guidance. Questions 1 and 10 to 13 for your reference. The draft standard requires that Ontario dentists comply with any applicable licensing requirements. They must comply with any applicable obligations for virtual care. They must provide dental care in accordance with the highest standard of care, and they must ensure that the dentist has the appropriate liability protection coverage. So what does that mean? The next slide illustrates how each of these provisions apply in the various scenarios where virtual care may be delivered by Ontario dentists across borders. You can see here that there are 4 possible scenarios, And this infographic or a variation of it is included in the briefing note, draft standard, and FAQs. It is important to note that the draft standard does not provide specific information regarding liability protection coverage. The working group deliberately put the specifics of what is covered in the FAQs to allow us to update it if the coverage changes without having to bring the update to council for approval. The infographic provides the liability coverage details, and I'll take you through one scenario as an example. If you look at the second column, the Ontario dentist is outside of the province of Ontario, and they are providing virtual care to a patient who is located in Ontario. The Ontario dentist would have to be licensed in Ontario and comply with any applicable licensing requirements in the jurisdiction where they are currently located. For example, if the dentist is vacationing in Florida, they would need to check with the Florida Board of Dentistry to see if they need a license to provide virtual care to an Ontario patient. The Ontario dentist would have to comply with the RCDSO's virtual care standard and any applicable obligations set out by the Florida Board of Dentistry, whichever obligations are higher. The Ontario dentist would have to provide care in accordance with the highest standard of care, and the Ontario dentist would have to ensure that they have appropriate liability coverage for the virtual care they provide. In this scenario, the care would be covered by RCDSO's professional liability program if the patient is an Ontario patient. Please note that the PLP staff are working with the insurer to define an Ontario patient, and the draft FAQs will be updated accordingly. That brings us to the end of the presentation, and the questions we have for council are as follows. Number one, do you have any feedback on the draft virtual care standard or FAQs? And number two, do you approve the release of the draft virtual care standard for external consultation? I want to remind council that you will have another opportunity to review the draft documents before they are finalized after the external consultation. Policy staff and external legal counsel are available to answer any questions you may have. I'm now going to turn it back over to you, Hanno, to facilitate the discussion. Thank you.
Thank you very much, Nancy, for that presentation. And thank you as well for highlighting the two questions that I'm going to be asking council to consider right now. So first hand up is yours, Daniel.
Great. Thank you so much. Great presentation, Nancy, and it's an excellent document. However, I do have a major concern with one item in the document, and that is the conclusion that out-of-province dentists don't require a license. And therefore, I also have a major problem with FAQ number 12. And if I take a minute to explain, on page 128, the principle states that virtual care is the practice of dentistry. And while I respect the legal advice determining the difficulty of trying to enforce licensure for dentists who are out of province, I do not agree with the subsequent conclusion saying that therefore they do not need a license. My concern is that taking this stand undermines the entire principle that the people of Ontario should seek dental care only from those who are licensed here. And I believe there are potential knock-on effects with this stance. The document is very helpful in referring to and providing links for 6 other Ontario health regulators, including College of Dental Hygienists, physicians and surgeons, the College of Nurses, et cetera. They all require licensure for virtual care. And I believe the RCDSO needs to do the same. In any publication, I think we need to state clearly and unequivocally that licensure is a requirement to practice dentistry. And I don't think we should have an FAQ for the public whose answer to the question, do out-of-province dentists need an RCDSO license for this? The first sentence of the answer is one word, no, period. So again, I'm not disputing the legal challenges of trying to enforce this, but I don't agree that we should therefore publish and post a document that essentially says, well, it's okay to have a license. I really think we should just stand on principle. And I think the legal situation is independent of the need to have a license. Thanks.
Thank you, Daniel. Mark Eckler, you're next.
Also echoing very thoughtful, concise, well-written document. But furthering, I think it was Osama previously said, where does the intersection of educating dentists to protect the public and following standards, where do they intersect? And in this case, the three scenarios outlined where the dentist and or patient are outside of Ontario, I think sets some dentists up for failure. And if they are aware of the standards as is, it will set the dentist up from restricting access to care. Because if I happen to be outside of Ontario, just trying to get my patient out of pain with all good intentions, I have to familiarize myself with the standards of where I am physically located. Therefore, if I'm not aware of the standards, I may decline treatment, further worried about the liability that I will incur. Therefore, the public will get less access to care. Having said that, I'd like to compliment the committee and Michelle, the advisor in particular, who was very responsive to my concerns, and we had a long, thoughtful discussion. On another note, I would approve the policy as is for commentary to the stakeholders so they can echo their sentiments as Dan and I already have. Thank you.
Thank you, Mark. Noah?
Yeah. Thank you, Nancy, for a great presentation and great work by the group. I echo what Dan and Mark were just saying. And I also had a question about, you did mention that in the presentation that there will be required resources for dentists who are using teledentistry and to ensure that they would protect privacy. Will there be details in the document about how or the means that we're setting for protecting patient privacy?
And I don't know who I'm going to turn that over to. I don't know if you want to ask.
I can start answering that if that's okay, Hanno.
Please.
So Michelle here. And so there are some resources that are referenced and linked to in the FAQ document. So for example, there's a number of resources put out by the Information Privacy Commissioner of Ontario related to the provision of virtual care and privacy requirements. And there's a guide specific to healthcare providers. So that is linked and referenced, and there's some explanation of what content is found in the IPC guide in the FAQ question and answers, specifically to help guide dentists in understanding what their obligations are with respect to privacy and confidentiality. And if there are additional questions, I would suggest dentists look at the IPC resources that they have available for providers. And then barring that, contacting the IPC for further guidance if necessary.
Are you fine with that, Noah?
Thank you.
Thank you. Okay, so what I would like to do at this point in time, Mark Trudell.
Yeah, thanks, Manuel. I thought I'd slide a comment in here. First of all, great job, Nancy, in delivering the goods to you and your committee, and Michelle, to you and staff members, excellent presentation, excellent work. I look at this presentation through the lens of a public member, and my focus is 100% on risk management and risk to the public, enhanced, lesser, greater, resulting from the delivery of virtual care. I listened to the presentation and I note additional variables brought into play, the delivery of professional services to patients outside of the province of Ontario who may not be residents or citizens of the province of Ontario, for which this college, first and foremost, to my understanding, is focused on protecting the public, starting with the Ontario resident, and perhaps an extension, any Canadian citizen, and beyond that, any citizen outside jurisdictionally of Canada. So where this all leads me to is to what degree we may have hit the pause button and reached out and got input from risk management folks that are professionals in risk management, as to to what degree liability is enhanced or restricted To what degree this impacts on our professional liability program? And I'm specifically referencing the delivery of professional services jurisdictionally outside of the province of Ontario to non-residents. Just a lot of questions come up in my mind. I apologize. It doesn't take away from the quality of the presentation and the content. It just simply triggers additional thoughts and considerations that I leave with you. Thank you.
Thank you, Mark. I still have two people on my list, and just to reinforce that basically what we are going to be asked to consider momentarily is just to release this draft for external consultation. And please remember that council will have the opportunity, once that has happened, to not only see that feedback, but to provide further feedback themselves. Amelia, you're next on my list.
Thanks, Nancy, Michelle, and the committee for a great report. I agree. I just want to go back to what Mark said, and I agree with what he said. So let's say I'm in Florida, not that I have a place in Florida, and it's Friday night and you get a patient calling. So you realize you've got to deal with all these issues. How is it going to be possible? Let's say it usually happens at night and all these no emergencies don't happen during the day. How are you going to become all of a sudden familiar with all the rules and regulation of that state or that jurisdiction? Like realistically speaking. That's my question.
Thank you, Amelia. Rod, you're next on my list. Oh, Alan, do you want to address that?
I don't know if I'm going to cause confusion or if it will be of some assistance. I think the answer to the question as a practical matter is you're not. Okay. So you're in Florida, and a patient of yours, an established patient of yours, calls and says, I'm really sorry, but all the antibiotics you gave me just fell down the toilet and my kid flushed it and I need another prescription for antibiotics, okay? And the practical answer is that you're going to provide that prescription through a pharmacist, presumably in Ontario, who's going to refill the prescription. I'm just using it as an example. But we're not in a position to make comment on what the requirements would be in Florida and every other jurisdiction that a dentist who is registered in Ontario might be working in. We just can't say is what I think. So the prudent thing is that technically you are still subject to the law of the land when you're working. And that's all the college can say in that regard. And maybe if you're going to Florida, the first thing you do is you make inquiry of the Florida board as to what you can and can't do, because we can't say it's all right for you to do this in Florida. We can only say it's all right for you to do this with your patient in Ontario. And I think that's what you're saying. I don't know if that gives you a lot of comfort, but I think that's the practicality of the situation.
Can I comment?
Sure.
Well, what's wrong with, I don't see the issue. Like I'm not doing physical dentistry, obviously, in Florida on whatever patient, wherever, but I don't really see a danger to the public if you're just I couldn't understand why that was in there, that little spot, that little,
I think it's
section about that,
it's
about
only
having a
Amelia,
jurisdiction.
It's only, Amelia, because the college has no way of knowing what the laws are in every single jurisdiction where you may work.
Why does it matter if I'm giving advice? I'm an Ontario dentist. I have me in Florida. Patient calls. I don't understand why that would be relevant. I'm not. I know I'm giving advice and it's in Florida, but I'm really giving it. Does it really matter that it was online or on a telephone, or I'm not physically doing dentistry? So that didn't make sense for me to have that line when I reviewed the document about being in that jurisdiction, right? Like I can understand if I'm doing dentistry, but it doesn't matter if I'm in Canada or Ontario, Toronto, making a phone call, or if I'm in Florida. I don't think doesn't make sense. It would make any difference. Like, why would a Florida law apply, but I'm not doing real dentistry? I am doing dentistry advice, but not physical dentistry. So that didn't make sense to have that in there. That was just my thinking when I was reviewing it.
I don't think I can add anything other than to say that I agree with you, what you're saying, but that doesn't mean the Florida law doesn't say that what you're doing is practicing dentistry. I can't say that.
Okay, got it. Thanks.
Thank you for the question. Thank you for your response, Alan. Rod and Robin, you are the last two speakers on my list. So Rod, I'm going to you first. And Rod, you're muted.
My comments echo Mark's in that if we do go externally for comment and input, risk mitigation should be part of that discussion, perhaps with outside legal input as well, because there's a lot of what ifs and questions regarding the degree to which we can enforce these standards and the degree and the disciplinary procedures around supporting that under the various scenarios that may happen. So I think we should think that out the best we can. I mean, Amelia just brought up one example. So anyways, thanks.
Thank you. Thank you. And last speaker is Robin.
Hi, can you hear me okay? It's the first time I've spoken today. So I'm just going to take Amelia's comment and continue with it and just flip it in reverse because I deal with this all the time. I'm in a northern community with lots of retirees and lots of travelers and lots of snowbirds. And the snowbirds from here these days don't just go to Florida, they go to Portugal and all over the world, to be honest with you. I have a couple that go to Australia. And then just as a dentist that cares about my patients, I certainly appreciate, I'm actually not much of a traveler, so it's my patients traveling. So I feel like I couldn't possibly know everything for all the places my patients go. But as a dentist who cares about the long-term care of my patients, I certainly love when they call me with a broken tooth in Portugal. And obviously I can't do anything and I'm not prescribing anything to another country, but I love being able to look at my x-rays of their mouth and assess or help them make a decision on what they're going to do there rather than have a random dentist who maybe is just going to see them real quick for the one tooth and not assess the whole mouth. Like I just wouldn't want them wasting money doing crazy amounts of expensive work in a foreign country that won't be covered by their dental insurance and then come back and have me say, man, I would have just pulled that tooth. I wish you'd have asked me. So I guess I just don't want anything in there that limits me to just give my patients advice over the phone that would matter to their long-term care. I'm wondering if some sort of exclusion where if they're already your existing patient on file and they're just away for a chunk of the year, like if there's some sort of thing that can just be where there's an already existing, I think it'd be totally different if we're talking about, a friend calling me for advice and I don't know their mouth or, a patient's brother. I don't know their mouth. I really wouldn't give them any advice. But if you have an already charted existing patient on file with lots of familiarity of their mouth and you're just wanting to give them advice, I wonder if there can be some sort of clause for a pre-existing patient.
Thank you, Robin. And Alan, I see your hand up, so I'm going to go to you next, please.
Well, again, if this helps, if you're in Ontario and this is an existing patient, you have no difficulty.
Okay.
Amelia's scenario was she's in Florida. And that's what creates the potential difficulty, maybe not from a practical point of view, but it could be from Florida's point of view. So if you're in Ontario and you have an existing patient, as I understand it, there is no issue.
Okay. So sorry, just to go back on that, but even with her case, I'm not a traveler, but I'm sure lots of dentists here might be. So I still sort of feel the same way, even if I usually have somebody, if I travel, again, not very often, I have somebody covering for me for my patients here in Ontario. So it really wouldn't matter where I am because I have someone covering. But say you're gone for longer and you couldn't get someone, or you just want to give your patients advice, I'd still feel sort of the same way if it's an existing patient.
And I would say I feel the same way too, but we can't comment on how those other jurisdictions would view it.
Okay.
We can't control the other jurisdictions. That's the only issue.
Thank you, Osama.
Sorry, I just needed to comment on this too, because this was, is there a way that we could potentially keep it a little bit open-ended where you leave it to the discretion of the dentist who knows their patient? And I completely understand what Alan's saying, but then you've opened up a whole can of worms because I don't know, what if you're on a plane and you get a text message from a patient? Like, what are the jurisdictional rules around that? Like, I think what we're doing in essence is trying to mitigate any risk to this is we're creating restrictions that do ultimately affect the care. So in essence here, I think there should be some open-endedness with this, and I'd love to hear what when we put this out to the public to see what they think too. But access to care is one of the biggest component of this, and so again, I can come up with another 30 different scenarios that make it more challenging, and so I think ultimately there's got to be something in there that says, and to the discretion of the dentist, in the best interest of the patient, to to whether it's advice like Robin does, or she just gives them some direction, or if you just did a procedure on a patient last week and you know them very well, and you can direct them to somebody who could, and maybe give them some direction in terms of who they should see next back home even, so or an associate. So that's all part of the care that you're providing. I think it gets too complicated if you try to create too many restrictions. So I think that's what Amelia was trying to say, was that like there's all these variables now that we're going to try to figure out without really with creating more restrictions, really.
Thank you.
I had to say that.
Harinder.
Hanno, thank you. For sake of time, can we leave this discussion now, and because we're going to have another shot at that once the feedback comes from when we send it. All we are doing today is sending it for general feedback from profession. So once we get that, we will again have this discussion. I think we are pretty running late, so can we just carry on with this rather than prolonging discussion on it?
Okay, thank you. The only person still left on my list, on my speakers list, is Anthony Lishko. So are you in agreement to that?
Yes, I can agree. I just want to add quickly that Amelia, if she was ever going to get in difficulty, she would get into difficulty in Ontario, because that patient, if they were going to complain, they wouldn't go looking for what was the standard in Florida. That's all I've got to say. Thank you for
Okay, thank you. And thank you all for your comments. So right now I would ask that motion number 4 be placed on the screen. And I think thank you as well, Harinder, to pointing out that basically this will come back to council following external consultation and the input from the external stakeholders. But the motion that we are being asked to address right now is that council approves the release of the draft standard of practice, virtual care, as set out in Appendix A of the resources for external consultation. And I see Deborah's hand up, so I'm going to say Deborah is moving that. Anthony Lishko is seconder. All those in favor, please raise your virtual hand. And that is unanimously carried. Thank you very much. I think we have one short presentation still. It's about a 15-minute presentation that I think we can entertain now prior to going to break, for our afternoon break. And that is the college has learned about Ontario dentists and their practices through the annual renewal process. This item is for council's discussion. The materials for this item are at pages 148 to 150 of your meeting package. And this is a presentation on Ontario dentist and practice update. And I'm going to turn it over to Eric Dessau, data scientist, to provide council with a briefing on dentists practicing in Ontario. So Eric, it's all yours now.
Thanks very much, Hannah. I appreciate that. I know that we're over time, so I'll try to run through this as seamlessly as possible. In your briefing note, as Hannah had mentioned, or in council materials, this is on page 148 to 150. It's the overview and the background, and I'll allude to that in just a couple of slides. So right now, I'd like to draw council's attention to some preliminary results from data collected during the annual renewal, and we're titling it Ontario Dentists in Practice. Again, please check pages 148 to 150 of the council materials. That gives a bit more broader overview of the background as it relates to the annual renewal analysis. High level, dentists must renew their certificate of registration once a year. All registrants must renew. It opens in mid-October, closes about mid-December with a late renewal that extends into the next calendar year. This is a process that has interactions across all of the college. And just to highlight that, while this is a registration department-led initiative, it has heavy involvement from the staff dentists, as well as IT and SLT here, as well as feedback and input from all of the departments and teams across the college. I want to just make note of a few reasons why we're asking these questions. We're really interested in trying to fill in the gaps within the oral health landscape. Data and reports on some of the information that we're collecting, it's not readily available. We know that health human resources have been brought into the forefront of a lot of conversations within other healthcare professions. And the college is in a unique position to be able to ask questions from all registrants, all dentists across across Ontario. These questions actually happen to align with different aspects of our strategic plan. And we're using this and we're presenting on it to help inform the public, government policymakers, registrants, and researchers. I want to just make a note saying that analytics actually begins at the time of submission. We're using this, and this is, you don't have to spend a lot of time on it, but the idea is to show that we can track how members are completing how registrants are completing their annual renewal process. And this is the idea behind this, is to be able to use near real-time data in order to have better interactions with the registrants. When we compare this over the data that we collected last year and this year, we see very similar pattern results, granted shifted by a day or two. But this allows us to understand if we're receiving the correct number of submissions this year relative to last year. And this type of analysis and these types of analytics will only improve in subsequent years. Case in point, we were looking to ask the question, are we either over, under, or at the same point in terms of the number of submissions at each stage within the annual renewal process? And we can see, while we lagged behind it by a couple of days, for the most part, by the time we hit around the 2-month mark, we actually shot up beyond what we had anticipated. So for presenting the results from the annual renewal, I want to just make clear, and this is something that the dentists on the council would have seen, the annual renewal components actually consists of a few different segments. We have the statutory questions that are asked, and this information is actually given to different departments so that they can follow up with those registrants either during or after the renewal process. We also have a renewal questionnaire, and that's what I'm going to be presenting on, some of the results for the questions that we ask. The dentists are also asked to declaration question to review their addresses, to review their addresses. A separate questionnaire that's for the health professions database that is actually given to the Ministry of Health, and that's a requirement from all health professions across Ontario. And this is all before they can proceed to payment. So right now I'm just focusing on a few select results from different sections within the renewal and tying this back to some of the demographic data that is collected at the time of registration. I'll touch on limitations a little bit more in depth, or I'll explain a little bit more in depth towards the end, but just limitations in brief, and keep this in mind as we're reviewing the results. Data are self-reported. We know that survey fatigue can set in at any point in time. There's a lot of questions that we ask dentists, and we're aware of that. We also know that there are common biases that exist within all survey-related questions, and these can be acquiescence, responder bias, social desirability. So we keep that in mind when we're interpreting any results that we receive. So a quick few slides in terms of overall demographics. We had a 1.55% increase in the number of registrants who completed the renewal this year compared to last year. When we're looking at this in terms of the breakdown by sex/gender, we see that there's 43% of our registrants are female, 50% or 57% are males. This is a slight increase by 1% and decrease by 1% when compared to last year. What's interesting to note about this is that's when we saw an increase in the overall number of registrants. This didn't necessarily mean that there's a decrease in any one area, but rather an overall increase in the number of dentists who are identified as female as they're entering the profession. terms of comparison of age distribution as well, this is at a more granular level than we typically do analysis. But even comparing the last 2 years, it's very similar, and this is what we'd expect. Only a year has elapsed, so the number of dentists and how they're reporting on it, they've only increased by age by 1 year. And while this is interesting to look at in terms of how the pattern resonates to last year, if we're looking at a breakdown of more commonly segmented groups, we can see that comparing the females to males, there's almost a wave distribution here. It's a little bit easier to see in this case, but when we look at the breakdown of number of females versus males and the average age across the profession is 48.3 years. Comparing to females and males, this is just a comparison of 44.7 versus 50.1. So we can see that there are more females entering the profession, and that's what's weighting the average age slightly down. I'm going to refer everyone to page 191 of our bylaws in terms of what actual geographic areas are represented by each of these districts. But this is just showing the frequency distribution of those registrants in terms of where they belong in terms of our electoral districts. When we compare this to last year, we see a slight increase or decrease across different districts. There's not a lot to take note of here. When we have multiple years, then we'll actually be able to do better trend analysis. And this is also just to hammer home the point that dentists can technically change their primary practice location through the membership portal. So we can see changes there, but we're only capturing it at a single point in time. Now, as it relates to the annual renewal questions, we ask a few questions related to the clinical activity. And these questions, the percent isn't supposed to add up to 100%. It's really interesting to note that over 94% of our registrants report that they treat patients in a clinical capacity. And we do have 12% of our members saying that they work in some other form of capacity, some other non-clinical dentistry capacity. As it relates to ownership and operations, 51% of our registrants are owners of their primary practice. And we had an additional 42% said that they're not an owner of the primary practice, but they're an associate. During a typical year, what percentage of time do the registrants spend in private dental practice? We have over 84% of our registrants saying that they spend anywhere between 81 to 100% of their time in private dental clinics. And while this number itself is over 90%, I thought it was very interesting to point out that when we're asking how much time do dentists spend in an educational or research institution, we have 5% of all registrants saying that they spend at least some time, and that can be anywhere between 1 to 20%, so up to 1/5 of their time in an education or research institution. We actually have 1% of our registrants who spend 81 to 100% of their time in education or research. We asked one question this past year as it related to if dentists are practice in a clinic that is owned by a professional dental corporation or network. We had 23% of registrants reporting that they do. We didn't ask if it was their what particular clinic that it belonged to or how many clinics. We just asked a single question. We want to use this as a basis to understand what is the current landscape. As it relates to teledentistry and virtual care, we asked a number of questions, but these are some of the highlights that really stood out. 22% of dentists report that between 1 to 20%, or about up to 1/5 of their treatment, involves virtual care with the telephone. 5% will report about 1/5 of their time will be spent in virtual care on virtual calls, and 11% of our registrants spend up to 1/5 of their time with email. As it relates to access to care, I'm only going to show a few slides related to here. I know that I'm running out of time, but when we ask the question, does the primary practice where they work accept payment from patients on government-sponsored dental plans? We had 94, these are percentages, and we had 74.92% of registrants who said yes, their primary practice does. Now, we're not we didn't ask questions as it related to whether they accepted it or other members of or other colleagues of theirs at the clinic. But we did note that over 74% of our registrants reported that there is some form of government-sponsored dental plan that is accepted. In terms of the average percent of patients on various plans, 58% on average, an average of 58% of of dentists report that, 50% of all patients in Ontario are paying using private insurance. We have 13% using public insurance and 18% paying out of pocket. Smaller percentages for the last couple of categories too. And lastly, 15% of our dentists responded yes to providing volunteer dental services. Just to expand on some of the limitations of this, there are common questionnaire biases that exist in a lot of survey research. Acquiescence bias, the tendency to agree, social desirability bias, the tendency to be able to promote yourself in a more positive light. We also understand that there's recall bias. We know that dentists may practice their profession differently at different stages within their career, and also even that can vary within a calendar year. So how they're reflecting on their practice for the past 12 months may differ depending on what stage they are in. Also, all data that we're collecting is self-reported. So some questions ask dentists to report an estimate on the various number of hours that they spend in a particular location or a percentage of their breakdown. Again, these are estimates. With the number of questions we ask, and this is something that we have received in some of the feedback, is some dentists feel that there's a lot of questions that are being asked. Relative to other professions, we ask far fewer. There are some professions that ask a very extensive list of questions. We're keeping that in mind because we're always trying to find the right balance of what is the information that we can collect and the data that is going to be useful as it relates to operational initiatives and strategic plans, and also what is going to be too much of a cost for the dentist to be able to provide accurate information. We are aware of some instances, and this is something that we are always reminding dentists that they're the ones who are supposed to be completing the survey. And this occurs across other professions as well, where a profession not limited to dentists, but they may delegate this responsibility for the renewal to another person on their staff, which we consistently remind dentists of that this shouldn't be done. Lastly, some questions are specific to a primary clinic and other ones speak to the general practice. So some dentists may also get confused as they're flipping back and forth. Next step for this is just to complete the remaining visualizations and analyses and to make sure that that information and those analyses are getting to the right people within the college, specifically the project managers and the project sponsors for the strategic projects. We're also exploring another medium to disseminate these results. So whether that's a separate report or we make these available online, that's a discussion that we're currently having with comms and SLT. And we also are going to be entering into our new annual renewal cycle, which means we're entering into the process of revising our questions, connecting with the dentists that we have on staff, looking at ways to see what are consistent methods of data collection, how can we add in better logic to our system, how can we improve the overall experience. So it's a continuous process where we're looking for ways to improve. I'm going to stop sharing my screen. I'll leave it there. I'm going to hand it back over to you, Hannah.
Thank you very much for that informative presentation, Eric. At this point in time, Amelia, your hand is up. Do you have a question? Okay, I think Nalan, you have a question.
Yes, I do. Thank you, Eric. That's great. I just wondered, what's the process in which the RCDS uses to determine what the questions are and what questions will be asked on the questionnaire, which ones will be added for the coming year?
It's a great question. It's a consistently evolving process. The initial process was to do a scan of what questions are asked by other professions, not just health professions, but what is useful in terms of resource planning, and then taking the lens of what is going to be asked from a health human resource perspective. We wanted to take the objective of trying to be ahead of what is going to be asked of our regulatory body. We've seen that in the health landscape, other colleges are being asked questions that they may or may not have data to support. So we're trying to stay ahead of that and look to see what are policy researchers, what are different government agencies, what are questions that are being asked by other regulatory bodies internationally that can help inform the health human resource standpoint. From that, we're also looking to identify what are just general questions we have about the profession of dentistry that we can't necessarily answer right now because that data is either not collected or not readily available, in which case we can insert ourselves in a way to provide that information to dentists and to the public. And lastly, we wanted to be able to identify what are going to be the questions that we can use to help inform our strategic projects, which would then, of course, support our strategic plan. So that's something that we continuously are keeping in mind as we're reviewing different sets of questions.
Okay.
Thank you.
Thank you,
And-
Eric.
Oh, sorry.
Thank you, Hanno. Great presentation. I just wanted really, I don't have questions, just two comments. First one being that, that I'm not sure, but I'm hoping that we have given members the opportunity to either not declare gender or to declare some alternate gender, because that is relevant to a lot of people. And secondly, just a comment, Eric, in that ever since people have found out that I've been on the college, they've been telling me that there are too many questions that they have to answer in the renewal. And I know you know that, but I'm going to say that you guys are working really hard at paring the questions down to only ask the most important ones for data collection. Thank you.
Thank you. Thank you very much for those questions. The first one is that data as it relates to gender or sex is actually linked back to the time of registration. And the answer is yes, we do provide other options. That's just not something that we reported on here. It was dichotomous just because that's a reflection of the data that's currently there. But yes, we do provide that option for registrants at the time of application. And there's a different avenue for them to say revise or update that as life changes occur. The second one is thank you very much for communicating those results. We're hoping that as we disseminate the information, that will help ease the types of requests or inquiries that are coming to you or other members of council, so that we can showcase the value of the information and the data that we collect to help inform how dentistry can be perceived as a profession and what are the current limitations of practice, of how dentists practice, as well as where we want to go with it. Thank you.
Thank you. Dan?
Yes, I just wanted to comment that we as a regulator are in a very unique position to be able to collect this information on an annual basis from 100% of the profession. And so we have to be sure that we are doing so responsibly. And that means explaining the purpose, providing the results as we're doing today, and we will continue to do in terms of other forms of publications, and making sure that we find that balance of how many we ask and how many is reasonable and what purpose will it be put to, because there are a number of things that we could collect, but we just don't. And I think, you know, as Eric showed you one of his earlier slides, we have a number of obligatory questions that we have to gather. And that includes the ministry's data set that's been in existence for 20 plus years, and also statutory questions that help us to understand things about dentists in terms of, have you had criminal charges or convictions lately that you haven't reported to us? And we need to know that information. So we will keep working on the kinds of questions that we want to ask in this bucket that will help us to understand the profession and will actually drive forward either college changes and policy supports or system changes like health human resources planning that Eric referred to earlier. And we will do so in a responsible way. But I think, I hope you're seeing some of the possibilities and benefits of the data that we've provided today, and more to come. So thank you.
Thank you. Aaron, last speaker.
Thank you. Just a quick question. I was wondering if there were going to be any questions on this coming survey in this fall about what's happening on the ground level with the health human resources, just shortages of hygienists and administrative staff and dental assistants, because I think this is something that's really having an impact on access to care and could potentially be an area that we could collaborate with other colleges on going forward. So that's just some thoughts there. Thank you.
Yeah, thank you for sharing that. That's something we'll take back. We're well aware that that's something that's a concept, that's an idea that is out there in the dental landscape that people are interested in. We do collect some very bare minimum basic information in terms of the composition of different associates and staff members that exist within the dental practices. Again, limited to say primary practice. There's a lot of limitations with that. It's something we're currently reviewing and analyzing. And once we have that analysis done, it'll help inform any additional questions that we potentially could answer, given some of the technological limitations and the number of questions that we ask overall. We'll definitely take that back. And thank you for that, Aaron.
Thank you. And again, Eric, again, thank you very much for a very interesting presentation. I see the time now, Council. We are going to take a short break. We will resume at 3:10 to continue on with the rest of the agenda. Just a reminder, please, to mute yourself, turn your video cameras off, and reconvene at 3:10. Thank you very much.
Great job again, Anno.
Thank you. Welcome back, Council. The next item is in regard to the college's audited financial statements and the appointment of the auditor. As part of compliance and good governance, the college undertakes an audit each year. The material in your package can be found from pages 151 to 193. This item is for Council's decision. There will be 3 motions, and we will consider them separately. Mark Eckler, Chair of the Finance, Audit and Risk Committee, will make some introductory remarks, and then Kelly Tripp, Director of Finance, will walk Council through the materials. So I'm going to turn it over to you first, Mark, and then to Kelly. Thank you.
Hanno, thank you very much. I'm pleased to bring you the audited financial statements on page 155, as Hanno already stated. I'd like to thank my colleagues on the inaugural Finance, Audit and Risk Committee, otherwise known as FAR. Rod Stapleforth, Neil Silver, Mark Trudell, Peter Deline, and Harinder Sandhu for their commitment and support, as well as the consistent commitment that is shown by Jeff, Kelly, and Sharon for their thoroughness, their work, and their support. A primary duty of FAR is reviewing the external audit process of the college, including a review of the audited financial statements to ensure that they are reasonable and they can be recommended to council. 2 sets of audited financial statements are prepared for the college: the RCDSO financial statements in Appendix B, and the fund financial statements for the RCDSO pension fund in Appendix C. Motions for approval of the financial statements are included in the business notes. Detailed financial commentary has been provided in Appendix A, which for context for the numbers and notes in the audited statements. Our audit firm, Tickman LLP, continues to be thorough and well organized, and the committee has recommended they be reappointed as auditors for the 2023 audit. A motion is here for recommendation in the business notes. The role of the external auditors to provide an opinion for the financial statements, ensure there are no significant deficiencies, and review the appropriate internal controls are in place in operating efficiency. The auditor, once again, has issued an unqualified, in other words, a clean audit opinion, indicating there's reasonable assurance that there is no material misstatements. The auditor partner and auditor manager, Frank Tinkman, attended the May FAR committee and presented their report for the 2022 audit. In their report, they explained their independent standards, the steps they undertook in the audit process, and the audit risks they focused on. The committee has also had an opportunity to meet with the audit partner and the audit manager from Tinkman in an in-camera session without the staff. And once again, we have no issue of concerns that were identified. At this point, I'll ask Kelly Tripp to make some highlights of the financial statements. Thank you.
Thank you, Mark. Good afternoon, everyone. As Mark said, I will provide you with some highlights from both sets of financial statements in your package, Appendix B, page 163, and Appendix C, page 179. The college statement of financial position shows how the college is doing at a specific point in time, providing a snapshot of its assets, liabilities, and net assets. There are several positive indicators, and the college remains in a strong financial position. One area we are working on is our operating reserve, which is underfunded. We will work with FAR to develop a plan to rectify this deficiency. The statement of operations shows that we ended the year with a deficit of $182,000, which is $549,000 above budget and an improvement of $1.7 million compared to the prior year. This is a good news story. Compared to the prior year, total revenues are $2.63 million lower. The registration and annual fees are up by $593,000, but investment income is down by $2.64 million due to the poor performing markets. The good news here is the recovery in the value of our investments has been seen, as you can find on your April 2023 financial statements found on page 239, that indicate we have already exceeded our annual budget for investment income. Expenses of $32 million are $4.3 million lower than last year, which is mostly the result of the PLP loss provision, which is down $4.4 million year over year. To correctly reflect the actuarial assessed PLP obligation, a large adjustment was booked to reduce the liability and adjusted through the stop loss provision, resulting in a large decrease to the expense in 2022. The second set of financial statements requiring approval is the fund financial statements of the RCDSO pension fund. The requirement for the pension audited financial statements is based on reporting regulations of the Pension Benefits Act and are reported to FSRA to meet their requirements, which is reflected in the auditor's report. Under this basis, the actuary's liabilities of the plan are excluded. So these financial statements are not an indication of the adequacy of the plan's assets to meet its pension obligations and should not be used for purposes other than satisfying our regulatory obligations. Appendix A, pages 153 to 162 in the agenda package provide more detail about the statements, and we are available for any questions at this time. Thank you, and I'll pass it back over to Hannah.
Thank you both, Mark and Kelly. At this point in time, before we start entertaining the three individual motions, are there any questions? Anthony Lisho. Oh, you're muted.
Thank you very much, Hanno. I have one question. For the pension fund, I noted that it was administered by IA Financial Group. Is that also the case with the RCDSO fund?
I'm going to turn it either over to Kelly or to Mark, whoever would like to.
Yeah, sorry. I just want to make sure that I understand your question. It's just that both DC and DB the assets are being managed and held at IA. Is that what you mean by the location? Yes. I'm not sure what you meant by the RCDSO versus the pension fund.
Well, there are two funds, correct? There's an RCDSO fund and then there's a pension fund. Is that correct?
There's like a DC and a DB plan, like a defined contribution and defined benefit plan.
Right.
Is that what, and those are, yeah, and the funds for those are held through IA. But the set of financial statements, is covers both plans. The ones that are the audited statements, they cover both pension plans.
Right. And so the administrator of these funds or the investment company is IA Financial Group?
Yes.
Okay. And what time period or how frequently is it reviewed in terms of performance of this particular financial group?
Sorry, like, do you mean like what the pension committee oversees?
No, my question is the performance of what they do with our fund reviewed on a 3-year basis, 5-year basis, that sort of thing, so that we can see what other financial groups might be able to do.
If I can interject, Ed, we have several meetings a year, and they do present how they are doing and how we are doing compared to benchmarks. Way more than every 3 years. It could be 2 to 3 times per year.
Okay, I guess I'm not being clear. Do we ever entertain looking outside of this particular group?
Maybe I can step in. So we haven't, since I've been here. We haven't done that exercise, but we do compare to external organizations via the benchmarks that are set. And we have regular meetings with them. They provide that information to us on a quarterly basis. And the committee, the pension committee, who is provided, comprised of skilled individuals who understand this, I think are satisfied with the investment people we have working on this at IA. I don't know, Jamie, if you want to comment.
Jamie?
Yes, my hand just went up. Can you hear me okay now?
Yes, we can.
Okay, good. Regarding the pension plan, yes, we review, the committee does review returns. I think what you were asking, Anthony, is are the pension funds managed by the same firm that manages the RCDSO investment account? Okay, Jeff, over to you again. The investments that the college has, not the pension plan, are they managed by IA? Yes, the answer is yes. And are they reviewed at the same frequency that the pension plan is reviewed? Yes. There hasn't been a search, to the best of my knowledge, over the last 3 years for different managers. But Jeff will say that there is a different manager as well, right? Jeff, I hope you'll nod on that one with regard to the college's funds, and you can divulge the name, I'm sure.
Yeah, we use RBC Dominion Securities for the college funds, and then IA manages all the pension funds for us.
Yeah, I may have confused the issue there. That is correct, RBC with the college funds. And yes, they're, at least from my experience when I was on the now FAR committee, they do a spectacular job as well. And their performance is compared with others out there all the time.
Thank you for that. So Anthony, does that answer your question?
Thank you, Jamie and Jeffrey. That does answer it. Thank you.
Thank you, and thank you all who answered the question. I have no more people on my speakers list, so what I would ask is if we could have the first motion, which is motion 5A, on the screen for council's consideration, please. And that motion is that council approves the December 31st, 2022 RCDSO audited financial statements as presented, and that the president be asked to sign an official copy on behalf of council. And I'm looking for a mover, please. Moved by Ram, seconded by Mark Trudell. Are there any questions specific to this motion? Okay, I see some hands, but I'm thinking people are already. So what I'm going to say is, all those in favor of that motion, raise your virtual hand, please. And that motion is carried unanimously. Thank you very much. If we could have motion number 5B on the screen now, please. And I would ask that members of council can lower their hand now. And motion 5B is that council approves the December 31st, 2022 audited financial fund statements of the RCDSO pension fund as presented, and that the president is asked to sign an official copy on behalf of council. I see that's moved by Brian, seconded by Anthony Lisho. All those in favor of that motion, please raise your virtual hand. And that motion is carried unanimously. Thank you very much. You may lower your hand now, and if I could ask to have motion 5C on the screen, please. And for council's consideration, that council approves the appointment of Tinkham LLP to conduct the RCDSO audit and the RCDSO pension fund audit for the year 2023. Mark Eckler is moving that. Anthony Lisho is seconding it. All those in favor, please raise your virtual hand. And that motion is also carried unanimously. And I think that's it for this item. So the next item on our agenda is the pension plan text amendment. And this relates to the college's pension plan and effectively maintaining responsibility to manage pension risks and costs. The material in your package that relates to this topic can be found on pages 194 to 197. This item is for council's decision. And Deborah, I see that your hand is up. Do you have a question? Okay, thank you. What I'm going to ask is Jeff Goldberg, our Chief Financial Advisor, will be leading the discussion on this item. So Jeff, I'm going to turn it over to you now, please.
Okay, thanks, Anna. So I'll just give a bit of background because not all council was here last year when this first came up. So back in December of 2022, council approved a plan to de-risk the pension plan by entering into an annuity for the DB segment of the plan. So the DB segment is a defined benefit, the much more risky segment. So what that means is an annuity equates to essentially selling the DB plan to an insurance company, which will reduce the risk for the college quite a bit. So since that December report, we have issued an RFP to find an insurance company that would take this on. And we did select the optimal proposal that we received, which was from Industrial Alliance, which is our current provider. So there is an advantage for that because with the same provider, any changes will be seamless to our pensioners. So that's a nice little advantage. We're currently negotiating the contract with them this month. But when you make changes like this, there's always changes in fundamental documents. So the pension plan text is the document that describes how the plan works, and that's provided to regulators. So there are two changes. Do you have something now, or do you want to wait until I finish?
I was just going to ask whether I understand that there are sort of procedural efficiencies, but isn't there some element of risk in having all of the college's different funds invested with the same carrier? I'm not a finance person. I'm just asking the question.
Well, all the funds are not. We don't use the same investment manager for all the funds.
But you're talking about using IA for all of the different pension funds, and now for the pension funds.
Right. So they've always had that. And
I'm just asking whether there isn't an element of risk in having them all located with the same company.
No, typically a pension fund would not use more than one investment.
No, but we've got more than one pension fund. Or we've got the pension fund and we've got the RCDSO investments. And they're all with AI?
No.
Okay, then I misunderstood. Sorry.
And in fact, what we're doing here is we're de-risking. So we are selling the DB book of business. So it's, we will no longer have those funds. So As a result of this annuity project, we have two amendments, which I'll briefly go through, and then maybe we can open it up for questions. So there's a disability provision. So plan members currently do not contribute to the DB portion of the plan. So when these members move to the DC plan, we don't want to disadvantage any disabled members by forcing them then to pay for their DC pension. So we're going to remove that requirement. And part two is for those taking a pension early, where there's an option to take a lump sum, we're removing that option because the pricing for the annuity was based on plan members collecting their pensions, not a lump sum. That impacts, like, I think it's 3 people, and we've communicated with all those individuals, and there's no issues that they have with that. So those are really my comments. Happy to deal with any questions.
Thank you very much for that, Jeff. Before we address or entertain the motion, are there any questions of clarification for Jeff at this point in time? And Mark Eckler and Jamie, I did see that your hands went up at one point in time, but I'm assuming either the comments you wanted to make have been made or the questions you had have been answered. Jamie?
I still want to just address Judy's question. Judy, there, as Jeff said, IA has taken the DB pension plan as a result of being a bidder. Okay, and in the process that the college went through, they went out and they obtained bids, and IA, because of their closeness with the college, provided the best bid. And the timing for all this to occur, the interest rates being quite a bit higher, it's very attractive. So not only is the timing attractive, the bid was good, and IA provided that, as I said, as a result of managing the funds for quite some time. And it would have been a real mess to transfer it to someone else, quite frankly. So I think the college was very pleased that IA was involved in the bidding process.
Thank you for that clarification, Jamie. And if I could ask that motion 6 be put on the screen now, please. And council, for your consideration, you are being asked that council approves the pension plan text as amended. And I have Brian Smith is moving that. Mark Eckler is seconding that. Please indicate your approval raising your virtual hand. And that motion is unanimously carried. Thank you very much. The next item on the agenda addresses additional clarity for the expectations of the president with respect to their meetings with staff, council members, and external events. At this point in time, I'm going to turn it over to Harinder, who I believe has a few comments that he would like to make. So Harinder, I'm turning it over to you now, please.
Thank you, Hanno. I just want to clarify to the council that I've been consulted on this matter. The key focus of amendment is to ensure that funds for work done for this role are used very prudently. This is not just about me, but about future presidents as well. The process will be more streamlined, and ultimately it may reduce remuneration, as a matter of fact, and save some money. It seems like a financially responsible approach, and I would now leave for council to decide. Please put me in the waiting room. Thank you.
Thank you for that context, Harinder, and we'll wait until Angelo moves you into the waiting room. Council, the material in your package that relates to this item is found on pages 198 to page 200. This is an item for council's decision, and I'm going to turn it over to Dan now, who will be leading this discussion. Dan.
Thanks, Hanno. And I don't have a lot to say, but I would draw your attention to page 199 and 200 of the materials. And as Harinder mentioned, there was a lot of consultation with him. and with the Finance Committee. This was approved by the Finance Committee to come forward to the to Council. And it was, it's really providing more clarity. I think essentially that's what it's doing. There has been some ambiguity within the bylaw, and it provides clarity in such issues like the purposes for the annual allowance that the president is able to attain and what that actually covers. So my experience with presidents is that there are many calls of 5 minutes. There are some shorter meetings of 10 to 15 minutes. And so the first allowance is meant to cover that. And so that's where most of the ambiguity has been resolved. And then on the section 10.2.4, providing some more clarity in terms of attendance at different external events, so that we are always assured that and clear that that attendance is contributing to our broader strategy and goals and where the president should be. So it's not meant to limit, it's meant to really provide that connection back to what we're trying to do as a college. So with Harinder's support and his active participation in the wording, it's before you for your consideration.
Thank you very much, Dan. Anthony Mayer, do you have a question?
Yes, I do. Thank you, Dan. My question is really just for those of us new to council. Could you maybe give us some historical context of how this matter used to be handled?
I'm afraid I don't have a long historical context, because this was the bylaw that has been present since I arrived. And so looking at a number of cost-saving measures that you've heard about over the past 2 or 3 years, everything for us as staff was on the table. And so we looked at all the different ways in which we were spending money, and this was one of them. And it was in some consultation with the former president, and then more consultation as we went to our new council cycle with the new president. And I don't have any more than that, Anthony, in terms of how this has changed over the years, but it was trying to deal with what we had and trying to close the gap where there had been some ambiguity.
So thank you. So would it have been like a multiple reimbursements here, there, and everywhere for various things, that this is just all encompassing?
Yeah, I think to be a bit more precise, there before it was probably related to charges based on those 5, 10, 15-minute meetings because of how it was worded. And so this is meant to address some of those issues.
Thanks.
Thank you. Daniel Haas?
Yes, it's actually a trivial comment, but for accuracy, 10.2.4F, which currently reads official ceremonies of Ontario faculties of dentistry, such as convocation or for internationally trained students. It would be more accurate to say such as those related to convocation or internationally trained students, because the president actually does not, at least at U of T, does not attend convocation, but attends our awards ceremony the morning of convocation. So it's simply for accuracy. It's trivial, but just to keep it accurate, if you could insert those words, it would be helpful.
Thank you, Dan. We can have a friendly amendment to that to say those related to.
Thank you, because that would be more accurate. Western may be different, but it's actually, the president actually does not go to convocation. It's our awards ceremony the morning of convocation. Thank you.
Thank you.
Thank you for that clarification. Mark Trudell? Mark, I'm not. Do you have your hand up?
Mano, yeah, I apologize. I was trying to put the mouse on the mute.
Okay.
I'd like to share with council that to the extent that this initiative's been triggered by and focused in regards to matters pertaining to remuneration finance, it also aligns really well with governance. And let me bring to your attention in particular section 10.2.4 speaks to permitted attendance on page whatever, the second page. You'll note deleted was meetings with senior staff of the college. And that aligns really well with governance and the model we're pursuing. More specifically, this board, this council speaks through one person, that being the CEO and registrar. We have arguably one employee. And it aligns with the fact that the board, members of council, including the president, to some degree, should refrain from consistently one-on-one or supporting one-on-one meetings with senior staff other than the registrar and CEO, perhaps accompanied registrar and CEO accompanied by other staff members, but everything goes through the CEO and registrar. So it captures not only the financial aspects, but it captures and redresses that to align with current governance practices that we're all working towards. Back to you, Mano.
Thanks, Mark. If I could ask to have motion number 7 put on the screen, please. And for your consideration, Council, we're looking at a motion that reads that Council approves the proposed amendments to bylaw 10 as presented. And I see that Deborah is going to move that motion. Vivian is going to second it. And before we vote, I just wanted to remind you, since this is an amendment to a bylaw, this will require a 2/3 majority. So at this point in time, all in favor, please raise your virtual hand. And Angie and I will ensure that we reach the 2/3 mark. Okay, so we have 21 out of 22 voters. The 22nd person would be Harinder, who's in the waiting room. So that motion passes unanimously. Thank you very much.
Hanno, it's Dan. The minutes will reflect the friendly amendment to change the language in 10.2.4F.
Okay,
those related to.
Okay, so then because I misread that, that's all right, because the minutes will reflect that. That will be the motion that is moving forward, correct?
Correct, yes.
Okay, thank you so much for that, Dan. Angelo, if you could please bring Harinder back into the meeting. And I still see 3 people whose hands are up. So if you have a question, leave your hand up. If not, thank you. Thank you. Thank you very much. Moving to the next item on the agenda, which is reports to council. And this is going to be a two-pronged attempt, or two-pronged effort rather. Our next item cover reports for council information, and there are 2 separate sections. The 2022 committee reports are included in your package, starting at page 201 with the audit committee report and finishing at page 232 with the registration committee report. These reports are for your information. And because they are 2022 reports, we will go through them one at a time in case there are any questions. And because they are 2022 reports, I will ask any questions to be answered by the person who chaired those committees in 2022. First, we have the audit committee report, and the chair is Mark Eckler. So I will sort of slow down now so I make sure that if you have a question, you can ask it, as opposed to my rushing through and you're not being able to reach your raise hand function. So any questions for Mark Eckler and the 2022 audit committee report? Seeing none. The discipline committee report, Vice Chair Judy. Any questions for Judy? Seeing none. The executive committee, Sandy Venditti and Ben Lynn, chair and vice chair respectively, are no longer on council. If we have any questions, I will ask those to go through either Harinder or Dan. Any questions around the executive committee report for 2022? Seeing none. Finance, Property and Administration Committee. Any questions for CFO Jeff Goldberg? Seeing none. Fitness to Practice Committee. Any questions for Peter Deline? Inquiries, Complaints, and Reports Committee. Any questions for PCRA Director Jillian Slaughter? Patient Relations Committee. Any questions for Vivian Hu? Pension Governance Committee. Any questions for Jamie Colliver? Professional Liability Program Committee. Any questions for Dan or Alan LaChapelle? Quality Assurance Committee. Any questions for Director of Quality, Susan Taylor? And any questions for the Registration Committee? Thank you. So we're going to move on to the next section, which is part 2 of reports to council. And these start at page 233 with the council evaluation survey results, and they finish with the glossary at page 277. These reports, again, are for your information, and we are going to follow the same process. I will start in the order in which they appear. I will ask if there are any questions that need to be answered, and I will pause long enough, hopefully, to give you the opportunity to raise your hand if you choose to do so. So starting with the council evaluation surveys from December to January meetings, any questions? The financial update at 4 months into the year, any questions? The 2022 council election, selection, and committee appointment summary report. Any questions? Dan.
Not a question, but I wanted to pause on this. If you haven't had a chance to read it, to encourage you to read it. It is an information item, but it involved an incredible amount of work to really reflect on how the last election and selection cycle worked. We've got a number of action items that are more administrative that we will be taking. Some will be dealt with by the governance committee in its new iteration. But I just wanted to point it out because there's a lot of work that went into putting this together. It's got a lot of great information. And if you have a chance to read it even after this meeting, that would be great.
Thanks for that, Dan. Next item on the agenda, or next report on the agenda rather, is the College Performance Measurement Framework. Any questions for that? The RCDSO/NDEB Memorandum of Understanding. The 2023 RCDSO Council Work Plan. Any questions? Access to care. Glossary. And seeing no other questions, thank you all. And we are moving on to the next item on the agenda. A brief reminder to members that our next council meeting will be a hybrid meeting, and it will be held on Thursday, September 21st, 2023. For those who are attending in person, it will again be at Vantage Venues, which is located at 150 King Street West, Toronto. But rest assured, all that information will come to you further on down. September meeting will be live streamed as usual. And before we address the motion to officially adjourn the meeting, I would like to take this opportunity to thank all members of council for their level of participation today, for their preparedness, for the kinds of conversations and discussions that we have. I would also like to take the opportunity to express our gratitude to all those faces who we do not see on the screen, but sort of the names behind the scene who have worked incredibly hard to put this council meeting together, to support us all in the variety of roles that we have. I think it behooves us all to be very appreciative of the incredible amount of work and time and support they provide for us. And Dan, I see your hand is up. Would you like to make a comment?
Yes, just we've incorporated the parking lot as an item, and I just wanted to not go over a lot of the direction that you gave us on the various items, but there was one item that was raised by Judy earlier today, and I wanted to just turn it over to Harinder just maybe to provide some closing comments and some ways in which we can move forward with what we think the concerns are that Judy has been expressing.
Okay, thank you very much for that, Dan. Harinder?
Thank you, Hano. Thank you, Dan. Going back to Judy's concern this morning, I want to make a couple of comments. First, I believe, Judy, you have expressed concerns about the lack of council input to the strategic plan. You heard Andrea's response, and I, as a council member for the past 3 years, concur that council has had numerous opportunities to contribute to the plan. We benefited from significant information from stakeholders in one of the largest consultations this college has done. We had small group sessions with council to gather feedback, and strategic planning is on every council agenda. That aside, I also want to try to reflect my understanding of your concern that we must always be attentive to adequate council member engagement on important directional issues. Judy expressed her concern, and while I'm not hearing the same from others, maintaining council engagement is necessary. And I suggest that we allow the executive committee to consider this in July and make a determination about what kind of focused discussion at the September meeting will help to keep the engagement activities front and center. We can look at this as a further effort to get better as a council, and I'm happy to take this away for further consideration at the executive meeting and bring it back in September council meeting. Thank you, and I also want to thank all of you for your participation, your diligence, and the staff for their absolutely amazing work. They bring us all the documents in time, and this preparing is time consuming, not easy. Thank you so much, and senior leadership team, Dan, thank you so much for your leadership, and enjoy the summer, and look forward to see you in September. Most of hopefully all of you personally.
And thank you for those comments, Harinder. Quite often at this point in time, we do go to in-camera. There are no items for an in-camera session today, and that's why that is not on the agenda. But at this point in time, I wish you all a happy summer. I would like to have a mover to adjourn the meeting, moved by Mark, seconded by Anthony Lisho. All those in favor, you can raise your virtual hand one last time before we break for the weekend. And that motion is carried. Thank you again all for your participation, and have a wonderful summer.